Good morning and good afternoon, depending on where you are in the world, and welcome to this International Science Council knowledge sharing session on the power of food science and technology and nutrition for sustainable planet and health. Over the next 2 days, we'll be exploring the issues around food science and how to move forward the outcomes of the recent UN Food Systems Summit, which took place in September. The knowledge sharing sessions are brought to you by ISC Members, the International Union of Food Science and Technology, and the International Union of Nutritional Sciences. My name is Alison Meston, and I'm the Director of Communications for the International Science Council, and I would like to welcome everyone here today. Before I hand you over to your co-chairs, Dr. Vish Prakash and Professor J. Alfredo Martinez, let's do some housekeeping. This session is being recorded and there will be simultaneous interpretation in French and Spanish. You can hear the simultaneous interpretation by clicking on the interpretation globe at the bottom of your Zoom screen. Of course, we'll also make this recording available along with its presentations in the coming days. So this is a Zoom meeting, so your microphones will be muted during the presentations, and we welcome your comments in the chat function. If you do have a question for our presenters, please write this in the comments, or alternatively, you may raise your hand like a normal Zoom meeting and moderators will bring you in for a question and you can unmute your mic. Please do keep your question short. In our many talks with ISC members, one thing has become abundantly clear, and that is that scientists and their communities want to engage in dialogue and share ideas to find solutions to some of today's global and wicked challenges. The ISC looks forward to continuing our role in these dialogues and by advancing science as a global good and finding actionable pathways to living within sustainable planetary boundaries. We have just recently released Unleashing Science, Delivering Missions for Sustainability, a call to action to all countries and actors for the need to urgently intensify efforts and realign priorities and resources towards longer term and more collaborative and drastically accelerated action. We've just finished the COP26, and I think you'll agree with me that if we are to keep within 1.5 degrees, these are the types of mission science projects that this International Science Council and its members must be involved in. In Unleashing Science, which I'll share in the comments in just a moment, there are 5 key areas of priority actions. And the first key area actually is food. And we say we need to be able to have a priority action for food, eating adequate and healthy diets without consuming nature's bounty. The second action point is water, replenishing nature's reservoirs to provide enough clean water for all. The third action is health and well-being, being whole and well in body, mind, and nature. The fifth is urban areas, thriving in places while stewarding the natural environment. And finally, climate and energy, shifting to clean energy while restoring a safe climate. So I think just in those 5 priorities that I've listed, there are a number of very clear touch points for our 2 unions who are bringing this webinar to you today, and the scientists and researchers who are part of this discussion. So our question and our challenge to you is, how can your 2 scientific unions collaborate and assist the ISC and its broad membership in building global scientific missions that address these challenges I've just listed? I wish you excellent deliberations over the next 2 days, and I'd now like to hand proceedings over to Professor Martinez. Thank you.
Thank you very much. First of all, I would like to thank you, ISC, for this very nice presentation and this very nice endeavor. After my sign of appreciation on behalf of IUNS, I would like to inform that the mission and objectives of IUNS involve the advancement of nutritional science and also encourage communication and collaboration with ISC and also with affiliate bodies like in Europe, America, and Asia. and of course, Africa. The current action points of IUNS involve capacity building to the organization of task forces and the implementation of congresses. Therefore, in the minute that I have been assigned, I would like to thank you again, ISC, and also the collaboration from IUFoST in order that this endeavor looks well and also is fruitful for the attendance and also for the society and the planet. Thank you very much. Hope you enjoy the next sessions. Thank you.
Thank you. Thank you, Alison, and thank you, Alfredo. A very warm welcome to all of you for this global knowledge meet with the fusion of food science and food technology with nutrition-packed programs of IUFoST and IUNS. Especially welcome all the past presidents, vice presidents of both the unions and all the unions who are attending today. IUFoST in its vision and mission has put its agenda to unleash the power of science by empowering scientific understanding of food, inclusive of sustainability, resilience, safety, wholesomeness, and the affordability index reaching to all strata of society globally. The agenda of value addition, reducing energy costs, and minimizing the water consumption in the food chain, including of preventing food losses and waste, which also means nutrition lost, is a very important agenda for all of us. I am very positive with the application of modern science and the scientific tools that it has today. Both the unions of IUFoST and IUNS, I representing the IUNS Vice President and also as IUFoST President, I'm very, very confident that with this wonderful way of fusion, things will emerge for solutions for global SDGs. 17 of them, out of them 13 to 14 really are touching the food science and nutrition. Thank you very much for this opportunity, and I thank ISC for this platform for creating this fusion, which will certainly make 1 and 1 11 and not 2. Thank you very much. Welcome to this wonderful meet of knowledge. Thank you. I hand over to Alfredo to introduce the first session of the speakers.
I will appreciate that Catherine Geisler, General Secretary of IUNS, and Francis Soto, member of IUNS board, can continue with the activity in this first session. Thank you.
Good morning or good afternoon, wherever you are in the world. What I'm doing this morning is just introducing very briefly the speakers for the introductory session. And later on, Francis Soto will take over the chairing of the session. So the first speaker this morning is Dr. Lynnette Neufeld. She is currently director of the knowledge leadership at the Global Alliance for Improved Nutrition and heads a team of more than 35 nutrition and food experts. In previous positions, she has been director of the Division of Nutritional Epidemiology at the National Institute of Public Health in Mexico. And she is going to be the president of the International Union of Nutritional Sciences at the next session of the council. So Lynnette is going to be talking on healthy diets, concepts, and controversies. We don't know yet about the order of the other two speakers this morning. One of them is Professor Ngozi Nnam. She is Professor of Community and Public Health Nutrition in the University of Nigeria, where she has served as Dean in the Faculty of Agriculture and head of the Department of Home Science, Nutrition and Dietetics. She is president of the Federation of African Nutrition Societies, or FANUS, and has served previously as president of the Nutrition Society of Nigeria. She will be talking about child nutrition for better life, giving us evidence from Africa. And the other speaker is Dr. Wilma Freire. She was regional director of the Food and Nutrition Program at the Pan American Health Organization in Washington, D.C. from 1994 to 2005. She was professor of nutrition at the Universidad San Francisco de Quito in Ecuador from 2005 to 2020, and is now emeritus professor at that university. She was elected vice president of the Latin American Society of Nutrition for the period 2018 to 2021, after which she assumes the role of president. And she will be talking about nutrition for healthy well-being and aging, evidence from Latin America. So we look forward to our first speaker, Lynnette Neufeld. Thank you, Lynnette.
Thank you. Good morning and afternoon, everyone. I am going to try to share my screen. Hopefully this will work. Okay, I'm assuming that everyone can see that appropriately. So as was mentioned, I'm going to talk about the topic of healthy diets and mention and discuss a few concepts and controversies to get us started for the day. So, sorry, I'm just going to have to fix something here because it's blocking my screen. One moment. Okay, so as many of you know, there's been an unprecedented focus on diet quality in the past year or 18 months, much of this motivated by the Food System Summit, although several other activities and current dialogues are bringing the importance of diet quality to the forefront. We know that nutrient poor diets are a direct cause of the persistent undernutrition that we're seeing in the world and the many associated health impacts of insufficient nutrition. But we also know that unhealthy diets are a well-established risk factor for non-communicable diseases and all of the morbidity and mortality associated with that. Recognition of the role of the food system and food environments in fostering unhealthy diets has come to the forefront, at least from my experience, like never before. It's always been recognized, but it is truly central now to our discussions and our understanding of why people consume unhealthy diets. There is a new and growing focus on the link between food systems and the environment, as was mentioned in the opening comments. This interest has highlighted some very important gaps in relation to healthy diets, and I want to talk about two of those. First of all, there's no consensus on the definition of a healthy diet, nor on how we should measure it or make judgments on the extent to which healthy diets are being achieved. Terminology is used inconsistently, which causes an enormous confusion for non-experts in the field. There's a lack of data on diet quality in most regions of the world, and where there is data, there's a lack of consistency in the messaging related to the best metrics and the benchmarks to assess the quality and judgments related on the quality of the diet. So we're going to take some time to talk about these two issues over the next few moments. So just to keep in as a reminder, let's talk first about definitions, metrics, and benchmarks. And then let's talk about the purpose of data and how well those metrics and data are fit to specific types of purposes. As I mentioned, there is an issue related to a healthy diet. And over the past 18 months, I've been part of the science group of the Food System Summit and was asked by the organizers of that to work with colleagues to define a healthy diet that could be adopted as a part of the Food System Summit. Because in the various groups that were working, it became apparent that there were many different definitions, and it was difficult to get our narrative, common narrative, as people were using very different definitions. So we put together the definition that a healthy diet is health promoting and disease preventing. It provides adequacy without excess of nutrients and health promoting substances from nutritious food and avoids the consumption of health harming substances. So I'm going to work from that and talk a little bit now about, if we're using that as our definition, how can we measure the adequacy of the diet? And then what are the benchmarks from which we should be making judgments on the quality of the diet? So let's take a moment. I would like to talk about 3 different ways to interpret healthy diet, or to measure, sort of sets of metrics, shall we call it, that we could look at, and some benchmarks under each of those. So within the first category in blue, we can talk about the adequacy without excess of essential nutrients. This is an area that is quite common in the nutrition field, has existed for a very long time. And we might do this by looking at the adequacy of intake of individual micronutrients, energy, protein, other nutrients, and compare those to benchmarks that are have been developed and tested, such as, for example, estimated average requirements. And in the next slide, I'll talk a little bit about strengths and weaknesses. For the moment, I just want to introduce these 3 categories. Second, diet quality may be assessed, and it's for its alignment with a set of specific recommendations for food types associated with better health outcomes, such as, for example, the WHO recommendations, for example, consuming 400 grams of fruits and vegetables per day. And there are several, again, we'll come back to that. And finally, and more recently, the focus has become on assessing the overall quality of the diet or dietary pattern associated with better health. And in some cases, now also adding other outcomes where they are seeking to optimize the 2 outcomes simultaneously, such as the example of the Eat Lancet Commission diet for diets from sustainable food systems, which we'll come back to and discuss a bit more. But even prior to that, there were total diet quality assessments and guidance or metrics, shall we call it, such as, for example, the Mediterranean diet that has been in existence and studied quite extensively for some time. All of these current metrics and benchmarks have several strengths and limitations. So let's run through the 3 of them. If we look at nutrient adequacy without excess, this is what I would call a data hungry approach. It requires usual intake of foods so that those can be converted into quantitative estimates of nutrient intake. So it requires quantitative dietary intake data, which is a little bit arduous to assess, particularly in some contexts. Another challenge that we have is that there is currently no harmonized approach, and there are many questions related to the quality of those reference values, of the nutrient reference values. And I've put here a reference, if you're interested to read more about that, you can refer to the paper by Dr. Lindsay Allen et al., published in 2020. And an important consideration of this approach is that this diet quality assessment only captures select nutrients. It does not consider the food source of those nutrients. It does not capture non-nutrient bioactive components, and it doesn't look at the whole of the diet. It only is looking and focusing in on individual nutrients. If we then move on to that second category, the alignment with recommendations, there are several global recommendations to use as benchmarks, and I mentioned the WHO recommendation on fruits and vegetables. There are many other recommendations. There's a hyperlink here to show those if you're not familiar. Several of these metrics have been validated against specific disease risk, so they are reflective of the types of health risks that we want to prevent and minimize the risk of from improving diet quality. But again, like the previous example, these capture only specific dietary components, but they don't look at the source of those dietary components, the combinations of those, and how they come together in a whole of diet. So the third category, the overall quality of the diet, there are several metrics now available to assess overall quality of the diet, but typically they focus either on the specific components, for example, micronutrient sufficiency again, of specific population groups, such as, for example, dietary diversity, which was developed and validated to assess micronutrient adequacy or the risk of inadequate micronutrient intake, or they assess NCD risk. Many have been validated against disease risk, nutrient adequacy, or dietary guidelines. And again, there is a paper that reviews those various overall quality of the diet metrics that I've referred to here. There are some important advances in trying to bring these different components or these different interests related to the quality of the diet together. And the major strength of this is that there is an attempt to look at overall quality of the diet, but as I said, it tends to be dichotomized into aspects of the diet that are related to undernutrition or aspects of the diet that are related to overweight and obesity and related non-communicable diseases. And there are few that still bring those two together. And then under this category also, we'll come back to talk a little bit more about the Lancet, Eat Lancet Commission diet in a moment. So just to reiterate my concern around diet quality metrics that focus either on the undernutrition risk factors or the risk factors related to overweight and obesity. And that is the fact that we now know that across the globe, most countries are experiencing what we call the double burden of malnutrition. So that in most countries around the world, we are simultaneously need to address problems of undernutrition, persistent problems of undernutrition, together with the problem of overweight and obesity. This was a recent Lancet series on the double burden of malnutrition, showing the map of the prevalence across the globe. And I would like to note that this didn't take into consideration micronutrient malnutrition. So the situation would be even more dire if we added that to the many different manifestations of undernutrition that are reflected in this. So we cannot focus on diet quality assessment that only takes into consideration one element of diet quality. So that is a little bit of background. And now we want to talk about having diet quality metrics and how we want to use those metrics. And I want to emphasize in this regard that there is no one size fits all perfect approach to assessing diet quality and to assessing and to measuring diet using data for making judgments related to diet quality. So I've grouped the purposes of dietary data into three categories, and these are very broad, and we could probably spend a whole day talking about these different purposes, but just for the sake of argument, I've grouped them into three categories. One is to have some level of global tracking. For example, we want to track against benchmarks and report related to the SDGs, and that is and we want to advocate for healthy diets. That requires a certain level of detail. It requires certain characteristics that we'll come back to in a moment. But we also want, in specific geographical contexts or population contexts, we want to be able to plan and implement, and we therefore need to have knowledge of the specific issues that exist in those subpopulations and be able to specify recommendations based on local patterns and traditions. And of course, another purpose is research and evaluation. I'm not going to go much into detail on that. Obviously, anything that is any diet quality data that is required in research evaluation needs to be very aligned with our research objective or our evaluation that we're designing. So I'm going to take a bit of time to talk about the first two of these categories. For advocacy and for global tracking, diet quality metrics and methodologies should be standardized and comparable over time across geographies, population groups. If they're not comparable, we cannot track global progress. We cannot say whether we're achieving simply because our data is not comparable over time. In terms of advocating, we need to understand a snapshot of diet quality in populations, preferably using benchmarks that are validated, but they need to be simple, rapid, and feasible. Going into great detail for that purpose may not align well with our objectives or the resources that are available for such purposes. On the other hand, planning and implementing actions to improve diet quality and context require an overview of current dietary intake and pattern in those populations, but also the determinants of that dietary intake and patterns, and also disaggregation by subgroups. We know that not everybody within a population eats the same, neither households nor individuals within a household. And we must know that level of detail to be able to plan actions to improve diet quality. So again, we need valid metrics and methodologies. Ideally, they would be standardized, used in a standardized manner over time and place. But again, the extent to which that takes precedence over some of the other considerations will depend on the purpose for which we are looking for this data. I want to talk for a moment about two different examples. First, on diet quality assessment, and then we're going to come back to the Eat Lancet diet. So in terms of diet quality measurement, I've highlighted here two metrics, two approaches to assessing diet quality that have been recently published in the literature. And we'll take a moment to look at these two. On the left-hand slide, you see some results that are generated from a project called the Global Diet Quality Score. This is a quantitative tool that was developed to generate standardized and validated estimates of dietary intake that can be aggregated, for example, here across multiple nutrients. So they are very positive in the sense of that coming back to looking at various components of the diet rather than one simply. In this case, what I'm showing here is the aggregate nutrient adequacy for women using this new score and comparing it to another score that exists in the literature, which is the Women's Dietary Diversity Score. So several considerations here. This is a quantitative tool. It measures usual intake. It is standardized and validated against several health outcomes. It's a data-hungry tool. You need to understand usual intakes and, again, quantitative intake.
I think Lynnette might have some network issues. Let's see if she can come back.
Yeah, because she's got very few minutes to go.
Yeah. She seems to be with us still. Oh no, I think now she's gone.
Can we then bring in the second speaker?
Yeah, Francis and Catherine, would you be happy to go and start Wilma's presentation then?
If we can't get Lynnette back on, I think that's have to be the case, yes.
Okay, I think let's invite Wilma then to present.
And then perhaps we could ask Lynnette to come back on to complete what she has to say at the end of the session, Francis. Is that a good idea?
I agree.
Okay, let's message Lynnette when she comes back, so she's not surprised that she's seeing another presentation. I think let's go ahead with Wilma's presentation then. Thank you, Wilma.
My name is Wilma Freire. Thanks very much for the invitation to participate in this workshop. My topic will be nutrition for healthy well-being among aging, evidence from Latin America. I will touch three topics: introduction, nutrition situation, and conclusions. The population of Latin America and the Caribbean is aging rapidly. The population over 60 years will increase from 11 to 25% in 35 years. In 2050, the proportion of adults over 60 years in the region will be similar to that of Germany, Holland, Switzerland, Denmark, and other European countries. There is a great heterogeneity within the region. Belize, Bolivia, Guatemala, Guyana, and Haiti will be like China with about 15% of the population over 60 years. Bahamas, Barbados, Brazil, Chile, Colombia, Costa Rica, Jamaica, Trinidad and Tobago, Uruguay will be like Germany and Japan with a proportion of older population over 30%. In this figure, you could see the changes over the period of 2015 to 2020. There will be a complete different situation among the population by the year 2060, with most of the population aged. So we will be, as Latin America and the Caribbean, an aged region. What are the health conditions among older adults? Principal causes of mortality and morbidity are chronic diseases. According to WHO, 75% of deaths in the region are due to chronic disease, an increase of almost 20% compared to 1990. Population aging was responsible for around 15% of the increase in the total burden of mortality and morbidity related to chronic disease between 2006 and 2016. The principal cause of mortality and morbidity among older adults are cardiovascular diseases, including ischemic disease and cerebrovascular events. This represents 25% of the burden of disease in people aged 60 years or more. About 25% of the population over 60 years suffer from cardiovascular disease and is higher among men than women. The prevalence of these diseases increases with age, ranging from 10 to 12% among people from 50 to 69 years, or to greater than 40% among people over 70 years in some cases. Arterial hypertension is one of the principal causes of cardiovascular diseases. WHO estimated in 2012 that 50% of cases of these diseases could be avoided by controlling arterial hypertension. Diabetes is another chronic disease that has increased in recent decades, to the point that some studies refer to the diabetes epidemic in the region. Diabetes is responsible for 7% of the total burden of disease in the region among people 60 years of age or more, and 15% of older adults suffer from diabetes. The prevalence is slightly greater in men than women. In this table you could see the prevalence of diabetes divided by 4 groups of age: 50 to 59, 60 to 69, 70 to 79, and older than 80. I selected in arbitrary way some countries just to see some figures. And let's start with Argentina. In the younger, older people, the prevalence was 10%, but when they reached 80 or more, they went to 15%. Chile started from 7.9 and went to 12.6. Ecuador, my country, started with 10.3% and went to 14.8%. Haiti, which is one of the poorest countries in the region, started with 15.7 and went to 70.6. Skeletal muscle disease are the most common cause of chronic pain and impact the quality of life with regard to mobility and dependence. According to the global burden of disease, skeletal muscle disease are among the chronic conditions with the highest prevalence levels among older adults, affecting 1/3 of the people over the age of 60. They affect more women than men, and it is as high as 40% among people over the age of 80 in the region. In this figure, in this table, we can see the prevalence of skeletal muscles with the same countries and with the same age groups. Once again, if we look at Argentina, the prevalence in the younger aging population is 41.7% and went to 49.2% by the time elderly reach 80 years or more. When you look at Chile, is 44% and went to 49.7%. You look to Ecuador, went to 32.5 to 39.7, and Haiti went from 30.9 to 35.9. So it's very clear that these problems increase in the prevalence with age. Factors to consider: excessive consumption of alcohol or tobacco, sedentary lifestyles, and unhealthy diets. This is very well documented, and many studies have demonstrated that these are the most important risk factors. Data from the Global Burden of Disease estimated that 43.5% of the burden of mortality and morbidity due to chronic diseases are related to environmental, occupational, and lifestyle factors. Functional limitations: mobility, cognitive, sensorial, and communication. Dependency: when a person is unable to autonomously perform at least one basic activity of daily life. Difficulty related to basic instrumental daily life activities. Number of other adults in condition dependency, persons who require care. Socioeconomic conditions: living alone, living in households of children, living alone with a spouse and other arrangements. Extremely poverty, pension coverage. In Latin America, many countries have performed national surveys on aging population, and all these problems are very well documented, particularly done in urban areas and in many countries also in rural areas. In this context, in this situation of the elderly population in the Americas, what is the nutritional situation? People over the age of 60 experience greater risk of developing nutritional illness. In addition, aging is accompanied by a variety of physiological, biochemical, and psychological changes that affect physical activity as well as behavior, food consumption habits, and social relations. Metabolic, physiological, and biochemical process changes with age and tend to have adverse effects on nutritional status. Decreasing sense of taste, smell, vision, and interference with swallowing and the enjoyment of food. The loss of teeth and poorly fitted dentures interferes even more with this problem. Digestion and absorption of nutrients are affected by decreased gastrointestinal disease. Kidney mass and the number of functional nephrons diminish with age, which in many individuals produce decreased capacity to eliminate the products of metabolic discharge. This diminished size of the liver with a loss of hepatic function. Lean mass, the content of total water in the organisms, and bone mass decrease, while adipose tissue and plasma volume tend to increase. Lower metabolic index and decreased glucose tolerance mean that older adults are more vulnerable to obtain to obesity and diabetes. Physical activity: changes in body composition, factors to consider: increase and modification in the sense of taste and smell, frequent problems with chewing and salivation, which diminish or modify food consumption patterns, lower digestive and metabolic efficiency, problems of the muscle and bones, poor vision and auditory capacity, illness, cardiovascular, urinary tract, mental depression and anxiety and others, chewing, interactions between nutrient and medication. In conclusion, the increase of the older population, which is a product of demographic and epidemiological transitions, requires national policies that promote specific intervention programs. These programs should be based on the multidisciplinary and interrelated vision that contain specific responses to the problems that affect this population. In this sense, proposals for managing nutritional problems require joint interdisciplinary planning and the identification of specific areas of action. Proposal must be based on scientific evidence. While there is limited experience in the Americas and implementation, it is essential to study strategies and programs implemented in Cuba, Costa Rica, and Brazil, from which we can learn a lot of the successful results and also the problems that they have to get through it. These countries are examples of successful interventions with the participation of the population at the national and local level. Among the major aspects to be considered, the promotion of a new culture of aging. This is essential, that goes across the whole population. Additionally, and with a good reason, we have put a lot of attention in mothers and children, and we should continue doing that. But it's time to start thinking seriously in how to amplify this concern toward the aging population. The promotion of programs to solve specific problems, the implementation of specific services for aging population, an understanding of the characteristic of the process of aging that promotes harmonic relationship among family members and the community, as well as labor relations as places for transmitting experience and social support networks. Finally, the identification of thematic modules such as human development, health for all, contemporary culture, free time and recreation, social security and social services, and individual development and educational self-development. Thank you very much. I appreciate very much the invitation. I just would like to mention that in looking at the information available, there are so many specific themes to tackle that I decided to go into this direction because it could have been a little bit difficult to put more specific information in how to go around with nutrition interventions in this group of population. Thanks again.
Thank you so much. And Wilma has really been on time, in fact, under time. So we have quite enough time for us to go straight to Ngozi. And then after that, we will come back to Lynnette. So Ngozi, you can begin to share your slides with us and give your presentation. You have about 15 minutes. Please unmute.
Okay. How do I move from one screen to the other? How do I move? Good morning, everybody. The first one. Good morning, everybody. My presentation is on children nutrition for better life, evidence from Africa. The presentation will highlight nutrition of children in Africa, the challenges and the way forward with a view to ensuring better life and healthier life for African children. Nutrition is critical for healthier life because good nutrition is the foundation of child survival and development. The first 1,000 days of life is a window of opportunity for adequate nutrition to enhance children's ability to grow, learn, have a healthier life, and participate effectively in the class and in the society. You can see these children, they are very healthy and participating in the class. Nutrition in the first 1,000 days is critical for children because it's a period of rapid development of cells, tissues, and organs, including the brain. The first 1,000 days of life counts from start of a woman's pregnancy to her child's second birthday and is broken down into 3 major periods. The first one is period of intrauterine nutrition, that is the period of pregnancy spanning from 0 to 280 days. The second is period of exclusive breastfeeding, from 0 to 6 months, that is 281 to 460 days. Period of complementary feeding from 6 months to second birthday of the baby, and it ranges from 461 to 1,000 days. During the period of intrauterine nutrition, that is the pregnancy period, the mother is the main source of nutrition for the fetus. She supplies nutrients to the fetus through the placenta. The implication is that the mother should be in a state of good nutrition to supply the fetus adequate amount of protein, vitamins, minerals, fatty acid that are needed for proper growth and development of cells, tissues, and organs, especially the brain. The period of exclusive breastfeeding demands that the only source of infant nutrition is the breast milk. Nothing else, including water, should be given to the infant, because breast milk provides all the nutrients, energy, and immunological factors and substances that an infant needs to grow and for the organs to develop well, including the brain. Breastfeeding should be initiated within 1 hour of birth to stimulate breast milk production. The period of complementary feeding, the major source of nutrition is adequate and safe complementary food with continued breastfeeding. The complementary food should provide sufficient energy, protein, and micronutrients, because breast milk is no longer able to supply the nutrient and energy need of the baby. So the complementary foods should be able to fill the nutrient gaps. This is a picture of what we mean by nutrient gap. From the first bar chart, the lighter color represents energy from breast milk, while the darker color represents energy gap. Between 0 to 2 months and 3 to 5 months, the breast milk is providing all the energy required by the baby, but from 6 months, there exists a gap, energy gap, and the gap is increasing as the baby is getting older. That is why we need to provide the baby with adequate complementary food from age 6 months. And for other nutrients, you have protein, vitamin A, and there are still gaps. These are the gaps that need to be provided by the adequate complementary food. What I have just presented is the norm, the normal practice. For period of breastfeeding, the child needs to be exclusively breastfed, only on breast milk and nothing else, including water. For the period of complementary food, the child needs to be given safe and adequate complementary food alongside with continued breastfeeding. That is the norm that should be practiced. Let us see from this nutrient gap whether African children are provided with this norm in terms of their nutrition. This study was carried out in 7 African countries: Ethiopia, Tanzania, South Africa, Uganda, Mozambique, Zambia, to see the picture of nutrient gap, which will tell us whether these African countries are really practicing the normal nutrition practice, having the normal nutrition practices for children. And the nutrients that were explored were iron, vitamin A. The red color shows that there is high nutrient gap burden, while the orange color shows that is moderate nutrient gap burden. The yellow color shows that it is just mild. The nutrient gap burden is mild, while green color shows that there is it's very negligible, the nutrient gap burden, while the plus signs shows the certainty of the data obtained. For iron, we see that all the countries have high iron gap burden. except South Africa. For vitamin A and zinc, all the countries have either high or moderate vitamin A and zinc nutrient burden. For vitamin B12, it's only Zambia that have high burden. Then for folate, you have some 2 countries having high burden. Calcium, all the countries have high burden of nutrient calcium gap, except South Africa. The picture appears better for iodine, iron, niacin, B1, and B6. So the implication of this nutrient gap is that these countries, the children are not given adequate complementary food. Hence, we have nutrient gaps, particularly for iron, particularly for calcium. And the implication is that we should scale up nutrition education, community enlightenment program to enlighten mothers on the need to add iron-rich foods like vegetable, animal-rich sources to their traditional complementary food, and also add calcium-rich foods like milled fish bone and vegetables and animal source foods to increase all these nutrients that have high nutrient gap. In most African countries, children have experienced wasting, stunting, coexisting with overweight, and this is due to use of nutritionally inadequate complementary food. In most African countries, the complementary food is mainly from cereals like this ogi and other family foods. But with increasing nutrition education and community awareness program in nutrition, animal source foods, fruits and vegetables are increasingly integrated into the traditional complementary food, resulting in reduced incidence of stunting, wasting, and overweight in some regions over the years. This chart is showing us the young child feeding practices in different regions of Africa. The first line is the global presentation. The second one is Africa. Then the subsequent ones are the different regions in Africa. And when we look at the picture critically, we see that the yellow chart is for East Africa. And for East Africa, considering early initiation of breastfeeding, global percentage is 48. Africa has 52. East Africa tops that of Africa by having 65. Then exclusively breastfed for the first 2 days after birth, globally 65%, Africa 68%, East Africa still topping 83% with variation for other regions in Africa. For exclusive breastfeeding, global rate is 44%, Africa rate 44%, still the same as global. East Africa still is topping African rate, which is they have 59%, showing that this region, East African region, have good breastfeeding practices. When we come to addition of introduction of complementary food or feeding practices after exclusive breastfeeding period, we see that East Africa is not doing very well. For addition of egg into the food, is scoring 34%. For minimum dietary diversity, Africa is scoring less than global 24%. East Africa still less than African rate, 22%. Then for minimum meal frequency, still we have these variations. Then for minimum acceptable diet, which is combination of minimum dietary diversity and minimum meal frequency across board, we have very low values. Africa still scoring very much lower than others. Then for continued breastfeeding from 12 to 33 months, you still see East Africa topping that of Africa. So generally, East Africa has adequate very good breastfeeding practices, but when it comes to infant feeding practice, when it comes to child feeding practices, they are lagging behind. This one graph is showing the stunting rate in Africa. The first column is for the global, second column is less developed countries, third column is Africa and other regions in Africa, with this green representing the stunting rate in East Africa. Generally, over the years, the stunting rate has decreased. There's gradual decrease. But one interesting aspect is that East Africa is topping other regions in Africa, East and Middle Africa. Middle Africa is green, deep green. East Africa is this one. So because, as we noted in the previous slide, they have good breastfeeding practices, but when it comes to complementary feeding, they are not practicing the normal, and that has led to loss in the gains already established during the period of exclusive breastfeeding. Hence, the stunting rate is higher than other parts of the region. This one shows the prevalence of overweight across the regions in Africa, together with that of global. First one, red is global, orange is a less developed country, then yellow is for Africa, then these are for other regions of Africa. We see that there is increasing rate of prevalence of overweight over the years for all the for all the regions in Africa, with South Africa topping. South Africa is this one on coffee or dark brown color, topping across the board, together with North Africa. The implication of this is that more programs and nutrition education should be scaled up in these regions to enlighten them on best feeding practices to eliminate all these foods that are precipitating overweight, particularly sugary and starchy foods. Across board, children in Africa are stunted, wasted, together with overweight, resulting in double burden of malnutrition. In some African countries, children nutrition is inadequate, resulting to severe acute malnutrition. Children suffering from severe acute malnutrition are treated with ready-to-use therapeutic food. Ready-to-use therapeutic food is made up of milk powder, sugar, peanut butter, vegetable oil, vitamins and minerals. Some locally available foods like maize, groundnut, sesame, soybeans are used to reduce cost. The ingredients vary depending on local availability, cost, and acceptability. Studies conducted in some African countries like Malawi, Kenya, Zambia show that standard ready-to-use therapeutic food improve recovery from SAM and increase rate of weight gain. Ready-to-use therapeutic foods produced in Nigeria has been successfully used in treatment of children with severe acute malnutrition in Ebonyi State, Nigeria. This slide is showing the child at first presentation. She was 18 months, weighing 8 kg with mark measurement of 10 cm. On discharge, she weighed 9.8 kg with mark measurement of 11 cm. So you see very big difference and evidence of better life and healthier life by treating this child with ready-to-use therapeutic foods that were produced locally from local foods in Nigeria. This is a big development, and we need to scale up this practice. In conclusion, infant and young child feeding practice should be scaled up in all African regions to bring the rate of malnutrition in the country, to bring children in the country out of the different forms of malnutrition to enjoy a healthier and better life. Women should be introduced to true nutrition education. They should be enlightened on the use of locally available foods to increase micronutrient intake, protein intake, and to really include a lot of fruits and vegetables, as well as animal source foods, and the use of milk in their diets to improve the nutritional status of children and improve infant and young child feeding. Thank you for your attention.
Thank you very much, Ngozi, for your brilliant presentation. I would now give chance to Lynnette. Is Lynnette back? To just summarize in 1 minute the focus of your presentation, please. Ngozi, if you can then stop sharing your screen, please. Is Lynnette there?
Yes, I'm here.
Yes,
sorry
please.
for that interruption. My electricity went out.
I know, that's okay. Yeah. Please,
not a common problem in Switzerland, but it happens.
Yeah, just in a minute, if you can just summarize, our time is almost up.
Yes, so I'm going to, this is where I left off, but I'm going to jump down here. I wanted to make, so the point I was making, I'm going to go through this quickly. The point I was making is that the indicators and the tools that we should be used need to be fit to purpose. And there are multiple scores available now, some very well suited to global monitoring because they're agile, they can be consistently implemented across contexts, they are low cost to use, but they aren't necessarily adequate to do detailed planning in the country where you're looking to design programs and so forth, where you may need a more quantitative and detailed set of data that may be more difficult, more complex, more expensive to collect, but fundamentally important if you're going to make programs that respond to local needs. The second point that I wanted to make in going to the concept of sustainable healthy diets, we have this Eat Lancet publication now that sets out a global diet, but the reality is taking that from that which provides the indicative direction of travel to the reality of planning and context must take into consideration the local reality of diets, traditions, food affordability and availability. I'll leave the slides with you. This is an analysis done in Mexico with dietary data and shows the vast variation in current consumption patterns and therefore the changes that need to be made for several food groups by economic status and among indigenous and non-indigenous populations. Here, 2 additional analyses showed the affordability, or rather the cost in relation to income of the Eat Lancet diet that shows that it is highly unaffordable for some populations in some contexts as currently planned. And in this case shows that nutrient adequacy is not sufficient, particularly for women of reproductive age, for several nutrients that are critical, and women have higher requirements than men during this phase. So all of that to say, it's important that we have such indicative diets, but the reality is to use those metrics and take them down to the level of planning and designing programs to promote healthy diets from sustainable food systems requires substantial adaptation to context and using these kinds of data to guide those decisions. So in conclusion, there's unprecedented interest in diet quality, which is likely to bring additional resources to a chronically underfunded area of diet quality assessment, which is great news for the community. Reconciling human health with planetary health in assessing diet quality and promoting diet quality is going to add new levels of complexity to diet quality metrics, which we haven't really even started to grapple with, such as the origin and traceability of food. That's going to be a big area that is going to need additional research in the coming years. No single diet quality metric or method is best. We must ensure clarity of purpose for the diet and for the assessment, and judge the strengths and weaknesses based on that purpose, just like we always do in good research design. And several new initiatives are making progress in overcoming well-documented gaps in assessing diet quality, including the focus on malnutrition in all of its forms. And I'm just going to leave you with a slide that shows and links to several of those efforts that are ongoing and places where you can find additional information in this regard. Thank you. And again, apologies for the interruption of conductivity. Thanks.
Thank you very much, Lynnette. All too soon, our time is up. And I'm just going to take 1 minute and then hand over to IUFoST. I don't want to take much of your time, Anne. I know you are waiting patiently. But just to sum up, fortunately, there are no questions in the chat box. But what I've drawn from this in 1 minute is that Lynnette has just told us that indicators that are being used should be fit for purpose. And that is one big message that I've taken from this among the many other recommendations that she's given. Wilma went on to talk about the challenge about families, particularly the older persons. Now, the issue that I want to think about is what is the role of the younger generations in families? Now, when we were growing up as young kids and children did not want to eat, the mothers persuaded us in various ways, they cajoled us. Now that we've got the older generation, we have lost that sense of smell and taste. What is the role of the younger generation to try to persuade them to be able to eat? These things are very, very important to look at. Now, the last week, Ngozi presented brilliant information, but the question I want to ask is, how much is there a positive deviance across countries so that South Africa, that is doing well in certain areas, can share their knowledge with Mozambique or Zambia? And I think that if we begin to talk among countries like we do in Southern American countries, Peru, Costa Rica, Brazil, they talk among each other and the lessons that are learned are very, very helpful. If African countries can begin to do that, we begin to see an improvement in their diet and nutrition, and that is very important. So there are lessons that we can learn from South America, there are lessons that we can learn going forward. All too soon, the session has come to an end, and so I would want us to take a 5-minute break before IUFoST comes in. Thank you so much to the organizers for this putting up this brilliant session. Thank you.
Hello.
Hello.
Hi, Prakash. Over to you.
Hi, Doctor. So can we move on to the next session at this point of time?
Short break, or do you want to carry on right away?
Okay. It's a great pleasure to really introduce the session 2 from the day from IUFoST. The title of the session is Innovations in Food Science and Technology for Sustainable Food Processing. This is a wonderful session, ably chaired by Aman Virakarta Kusuma, who is a wonderful faculty, well known from IPM, which was formerly Bogor University, and an experienced person in the area of food technology. Currently, he is the member of the Indonesian Academy, as well as the presiding officer of the International Academy of Food Science and Technology of IUFoST. It is ably supportedly chaired by Feridun Shahidi, who serves as a senior faculty at the Memorial University of Newfoundland in Canada, and is also the president of the International Society for Bioactives and Nutraceuticals, and currently he also chairs the Scientific Council of the IUFoST, and I leave both the chairs to conduct this session, and all the best for the speakers. Thank you. Over to Oman and Feridun, please.
Thank you, Prakash. Hi, everyone. Could you hear me?
Yes, we can hear you.
Okay, very good. Thank you. So in this session, we would like to discuss several issues related to innovation and food processing technology, and also in relation to the sustainable food system. So the first speaker will be Professor Dr. Alexander Mathys. He's the head of Sustainable Food Processing Laboratory, Institute of Food, Nutrition and Health, ETH, Zurich, Switzerland. He'll be presenting novel food production and diets for more sustainable food system. It's your time, Professor Alexander.
Yeah, thank you very much for the kind introduction, and thanks very much for also inviting me to this awesome session. I learned a lot in the nutrition section, and I think it's really valuable that we team up and work together. And you will hopefully also see that in my presentation here, which is titled Novel Food Production and Diets. So we are really, we need to team up because we need to have your data. So when we talk about food system sustainability, from my point of view, we need to team up not only with nutrition, we also need to team up with social sciences, with the environmental science. And there are ongoing projects. The EIT Lancet report was mentioned, but there are also other reports and teams establishing open access reports. And you can see here the Nature Sustainability expert panel, for example, led by Cornell Acton Center of the Cornell University, by Professor Chris Barrett, an economist, and also others. And I want to clearly say our challenge is mainly a behavioral aspect, and we can stimulate behavioral change, for example, the reduction of consumption in developed areas by innovations. And I want to introduce some innovations to you, but I have a lot of respect about the social dimension of sustainability, because that is the crucial aspect here, really, to find the right way to tackle our major challenges which we face. Our approach at ETH Zurich is a multidimensional one. We are working on multi-indicator sustainability assessment. You can see here on the bottom, we go through the whole value chain. We use all three dimensions of sustainability, the environment, but also the social and economic dimension. We develop new methods here and prove that in case studies. We also work on solutions. So if you want to work on food systems, you need to understand the food system by multi-indicator sustainability assessment, for example. And then you can work on solutions, for example, microalgae-based proteins and lipids as a potential contribution for more sustainable food systems. We go through the whole value chain. I mentioned that already, upstream production and downstream. We have different research focus areas. Because of time reasons, I can only show some very specific aspects. And we work on black soldier-fly larvae, insect cultivation on waste streams. If you can't avoid waste on side streams, you can grow insects on it, and you can produce high-value protein and fats. You have to process them to the right product portfolio. And then we need to team up with a nutritionist, with the medical science and consumer science to really find the right way into our society. Yeah, how we can understand our system. There were already some very nice presentations, and these data which were presented could be nicely integrated into a multi-indicator sustainability assessment. Professor Chowdhury, the first author of this multi-indicator sustainability assessment, is also co-author of the EIT Lancet report. He was my former postdoc and excellent expert on the topic, and he suggested in his analysis 7 main domains based on 25 sustainability indicators, where we analyzed 156 diets in countries. And we suggested food nutrient adequacy, for example, as one of the dimensions, which is already part of the social dimension of sustainability, because nutrition and health outcomes are part of social sustainability. They are not quantified in the environmental sustainability, which is the second indicator, ecosystem stability here. And then we already go to the social dimensions. Affordability, availability was already addressed also in the nutrition section. What does it bring if we bring in great new microalgae or insect-based products and they are not affordable for the majority of the society? Social culture well-being includes also, for example, animal welfare. Resilience was a major focus during the COVID-19 crisis because our food system is based a lot on trade. Food safety, especially in developing areas, is still a big issue. And waste and loss reduction is a big issue in developed areas. For example, also in Switzerland, we produce 2.6 million tons of waste, and globally, that's 1.3 billion alone. That's absolutely unacceptable. All these sustainability assessment indicators are well aligned with the Sustainable Development Goals. And I want to show you maybe one comparison here between nutrient adequacy versus ecosystem stability. You can see here the indicators which we used. I can't go into very much detail. It's an open access paper published in 2019, and also the ecosystem stability indicators. That's aggregated in this global map of 156 countries. And we can see that in our developed areas, we have a good food nutrient adequacy, but for the price of a significant ecosystem stability loss. And that is mainly linked to our very high consumption of animal-based products. In other regions, we have significant food nutrient adequacy issues, especially micronutrients were mentioned also today. And here we can maybe improve. But here we don't have ecosystem stability issues, at least when it comes really to the individual national diets. Yeah, going further, maybe what can we do when we see such data? We can, for example, produce insects on waste and side streams, because the waste production is a significant issue and contributes to the ecosystem stability. We can use black soldier fly larvae, and here we, for example, collaborate globally with partners in Nairobi, in Kenya, with Sanaji, in Surabaya, with a pilot scale, in Wuhan, in China, but also in the US and other developed areas. We can produce black soldier fly larvae proteins and fats, and then process them to feed alternatives in comparison to fish meal, for example, that can improve availability, but also affordability and especially sustainability, because the majority of fish meal is based on small catch. How does it look, how a colony is looking like? You can see here, we would use a waste which we can't avoid, and that should be the first priority, avoidance and reduction of waste. If we can't avoid waste, let's pre-process it, add the larvae, and then cultivate them on the waste. And then we can produce, for example, protein concentrates and lipids out of such facility. We can also use the residues as a fertilizer, for example, and that can, for example, contribute to a circular economy. How does an environmental sustainability performance look like? It's a quite crowded table, I'm sorry. It's an open access publication from 2019. You can go into detail. What is special here, it's one of the first tables where we have an overview about absolute values, about global warming potential, ozone depletion, acidification, eutrophication, energy demand, freshwater depletion, and land use, also collected from literature. Our insect meal and puree, in collaboration with Protex, an industrial producer, so we used industrial data, not academic lab scale data, could show that they are more sustainable than almost all animal-based sources. Fish meal was maybe beneficial here because we couldn't add the biodiversity loss, which is linked to the small catch from the ocean, because there are methods lacking and data lacking. But insects can't compete so far with plant-based sources. Microalgae is strong hope in the more sustainable food system topic. However, so far they have a very high energy demand. They can compensate a lack of arable land, and that can be interesting, for example, for urban areas, but this energy must come from renewable sources. That is really a must, otherwise it's absolutely non-sustainable. Another aspect for new solutions is that we have to consider the technology readiness level of such solutions. And this is a very generic overview about technology readiness level versus resources. In the beginning, we have resources from academia and government, but then we have the valley of the death at pilot scale approximately, when the solution is somehow ready, but not ready for industrial scale in the higher technology readiness level. And then small and medium-sized enterprises, startups can bridge this valley of the death and bring the solution into our society. Just an example, now we could raise the most modern insect factory in the Netherlands with Protex, for example. However, we need to have 1,000 of these factories to have the economy of scale to replace 4 million tons of fish meal, for example, quite often from unsustainable sources. And so the technology readiness level, there has to be a fair comparison between highly optimized and highly scaled solutions versus new solutions. Coming to microalgae, that is a solution which is not really optimized yet, we believe. So we go here through the whole value chain via different research focus areas, and I want to introduce some of them to you. Microalgae, first of all, can grow on only carbon dioxide with light as energy source, and then you have green biomass. And that is done already globally. However, it's still a niche. We can also go for mixotrophic or heterotrophic cultivation. Then we can have a brighter biomass, which is much more viable on the market as ingredient, for example, as meat substitute. And we can also change the pigment concentration, which has also links to more nutritious and healthy biomass. We can use a lot of different applications, and functionality is really key to make a business case. So functionality, for example, can come if we replace animal-based whey emulsifiers with microalgae-based protein fractions. We can build up nice emulsions depending on the purity, with different layer thicknesses. So that is here now an interfacial viscoelastic network formation shown. We can go for very, very thin layers when we purify our proteins. However, then we lose a lot of major protein concentration. Or we go for the concentrate. We can demonstrate the functionality. We can replace emulsifiers in our product, get a clean label benefit, and can use a bulk protein, which is then much more competitive if we have a functional ingredient in our biomass as meat substitute ingredient. Here we mix soy with yellow microalgae from heterotrophic cultivation, has no chlorophyll, has no limited green color, which is always a bit of a problem with consumer acceptance, and could produce nice structures with a high moisture extrusion process. So we could demonstrate already now that it's feasible to integrate microalgae protein concentrate here, and we could increase the nutritional value with a higher vitamin E, B1, B2, B3, B6, without any additives. We just added the microalgae biomass, which has these vitamins, and the high moisture extrusion process didn't reduce a lot of these vitamin levels because it's a short, high temperature process only. That was also done with our ETH startup, which is currently very successful, currently built up a new factory in Chemtal with 110 employees. Yeah, if we go for microalgae for alternative protein and lipid sources, we also need to check more nutritional aspects, and that is not much known. Here we checked 3 different commercial biomasses with Nestle research on the protein and lipid bioaccessibility based on the in vitro digestion model standardized protocol InfoGest 2.0. We could see protein bioaccessibility is okay, is acceptable. However, the lipid bioaccessibility, and here we talk mainly about polyunsaturated fatty acids from such sources, is very limited. We could demonstrate that we use pulse electric field processing. We can permeabilize the membrane, release internal enzymes to the cell wall. We can increase the bioaccessibility. I can't show you these data yet. They are currently under review in our journal submission. We could integrate all these solutions into a microalgae biorefinery and develop, but also in developing areas, depending on the needs. Here you can see, for example, an algae house in Hamburg, where algae is flowing out of the at the surface here, and photoautotrophic cultivation. Then we go for a cascade-wise extraction, like we do, for example, with soy, what we do with wheat, from the most sensitive, low-volume ingredients, for example, phycocyanin, which is a functional ingredient already now used in industry, gets a very high value per kilogram, to the more robust and higher volume ingredients here in the second cascade. And then last but not least, we can use microalgae residues for energetic utilization to get energy for our cultivation, or for example, also CO2 as substrate for our cultivation. Yeah, that was published in all these open access publications. And for that, I thank very much the team of the ETH Sustainable Food Processing Group. We open up a new future food lab at the Singapore ETH Center, 1st of January. I will work 25% in Singapore, where we build up a new heterotrophic microalgae cultivation system with the National University Singapore, A-Star, and our Swiss food industry. And I would like to thank, especially for that, to the academic, applied R&D, and industry partner. And I thank you very much for your interest. Thank you very much.
Thank you very much, Professor Mathys, for your excellent talk. And now it is my pleasure to invite Professor Mitsutoshi Nakajima to start his talk. He is a professor in the Faculty of Life and Environmental Sciences at the University of Tsukuba in Japan, and he has extensive publication, 300 papers and 50 patents, which is quite impressive. Professor Nakajima.
Yes. So can you see?
Yes, we can see now.
Okay, yeah. Okay, thank you very much for the, excuse me. All right. So good evening, or good morning, or good afternoon. It is my pleasure. Thanks for your invitation to talk about our work. And today, something like the name Sustainable Solution for Personal Food Production through Disruptive Technology. But that is, I just introduced our moonshot program based on this brain, the one of the Ministry of Agriculture, the organization, and we called Moonshot Agriculture, Forestry and Fisheries Research and Development Project. I'm working in the University of Tsukuba. Okay, let me go. So this, I think, something a bit old, and when the time of the John F. Kennedy, he said we choose to go to the moon. So our government decided to start up this Moonshot Research and Development Program. It is, I think, ambitious goals to attract people and promote the challenging. So challenging those R&D projects with the aim of resolving difficult societal issues while bringing together the wisdom of the researchers from all over the world. And currently, actually, from this year, another two goals, but sorry, I could not include. There is 9 moonshot goals already decided. So just look at some of them, and those some realization of the society in which a human being can be free from the limitation of the body, brain, space, and time by 2050. Was some the ultra early disease prediction and intervention by 2050. And also AI robots, also some evolved intelligence and act alongside of the human being. And the number 4, also the like a global environmental issues to realize a sustainable resource circulation, something typical most people may accept. And I'm involved in this goal number 5. I will explain in detail more. And the other one is something more the quantum computing system, and also some sustainable care system. And another 8 and 9 is more the medical issues. So those, I think that anyhow, the overall goal is to realize the human well-being. And each these moonshot goals, there is one program director was decided, and there is several projects, and I am just one of the project manager. Okay, this is goal number 5. It was set the creation of the industry that enables sustainable global food supply by exploiting unused biological resources by 2050. So there are several, something like how to keep the better soil environmental condition. It can give much production. And also those optimal use of the biological function, and like in this case, zero food loss and waste. And already it is written in the some food loss materials can be utilized, and 3D food printing, or some reproducing some meal. So anyhow, the satisfying both food production and global environmental conservation. So that is, I think, the principal idea. And just to look at it is from, I think, the United Nations. So you see now we are here. So nearly 7 billion people, but now at 2050, almost 8 to 10 billion people. That is total population. But if we look at, think about population of the age 65 years, those aging population is now almost 9%, but you see, it's growing more and more, and 2050, it is going up to 16%. But this is, I think, in average expectation. But what's more, just a comparison, 2015 and 2050, the total population is almost 2 billion people. But as you see here, the developed countries are almost same, no increase. But the developing countries increased much. But if you look at 65 years old elderly population people, so we know that even developed countries, the 100 million people is increasing, and developing countries are quite much. And if I show the Japan's case, its population is now we are almost 130 million, but it's decreasing. But those elderly population is now 26, and this time 38. So quite much as compared to these. Okay, anyhow, so we always think about something expectation may be high because of the leading country in the case of the aging society. And this is, I think, the FAO, bit old one, but you see, food loss is rather much, 918. That is, I think, from production to until the distribution. So this is, I think, it is not used, although it can be used more. And particularly this roots and tubers case, it is so much. And even in oilseed and pulses, quite much. And this fruit and vegetable case, even more. So that means, I think, that we have to utilize these food loss materials more and more. And so one way is that how to make the powder and granule for the long-term preservation. And also, of course, the volume reduction can be okay. And also, we are planning to make use some the 3D printing system for personal food production. So what we thought was personal food from food loss materials. Of course, not all the case, but in principal idea. And also the quality of life for the elderly, also the lifestyle-related diseases, overnutrition, imbalance. There are so many populations. And of course, the personal food that meet individual taste and health condition. That, I think, that is something, the key word for the personalized food work, personal food. And of course, there are many ways, many measures have been taken that I think that there are several, the food processing, food dry, freeze-dried, or some canned retro packing and frozen food. But there is always some kind of the limitation. I think we expect that we have to find something new. Also, the developing countries, everybody may accept healthy food or supplements that do not taste good. That is also also in if we go to the terminal care house for the older people, and the food is not good at all. So research, which we say the AI chef machine or 3D food printing system, I think the point is AI-driven system. That may be, I think, the key term. So like several research should be, we already start to do the food roast powders, granules, and paste, and also the on-demand manufacturing using some, at least possible as we can, some kind of a digital design to create a complex food structures. And the idea is AI-based 3D food printing system that I think that can be used for provide of the personal food. Okay, that I think the general idea about this, those the material itself, food raws, some drying, pulverization, and some weight. And also, I think that we should do the life cycle assessment analysis. So all the system can be analyzed. And of course, there are several types of the 3D printing system. The screw type, those piston or some screw type is commonly used, but also we have to develop something new type. And also, I think the many those property data can be installed in the database. And this was just my colleague is a specialist of the LCA, so I think that all the system present flow, and also if in the future if we will develop this system, then how I think always this kind of the way in order to justify the new processes, it is needed. And not only those, I think the processing side, but also the we have to understand what is a tasty food. Because of the country to country, our taste is something different. But in the case of this, also we will check some kind of the dynamic evaluation during the mastification. Always the taste will become changing. So I think that there are variety of not only the making new type of the food, but also the model tongue or chewing robot or many the advanced technology. Also, we will determine the brain activity, pulse wave, blood glucose, and so we will find something, discover the characteristic pattern during the meal. So that I think that in order to get the integrated database of the food deliciousness, and that is, I think, the basic idea. So I will not take time, but if you check the internet nowadays, so many variety of the printing type is you can find out screw type. It can be used for some rather viscous fluid, and also those formulation. Our colleague, my colleague, Professor Hulka of the Nagata University's activity. So also those variety of the some nursing care meals or baby and the designer's food or nutrition tailored to the individual, and some kind of the new texture. You can find this something. It looks already common in the world, and also those nowadays the accuracy. After printing, okay, around 5%, it's not error, but you see the each different type. So that is, I think, the engineering technical idea. So almost, I think, it would be acceptable level. And this is also the new type of the bathtub or powder type. We are considering, and it's most important part. We are going to make the AI-driven system. So see, we can the individual can request the menu, and of course these individuals' health data can be in some network, and then you see. Not perfectly by request, but also the AI machine can consider about the individual's health condition. Then you see the already this AI-driven system might be understand this what kind of the food can be used, and also what parameter to kind of the cooking. So finally, there's some taste food, but in all the case, already I think a huge amount of the database we have to build. We expect not only the Japanese type, but we have to do in international database we are expecting. So this is the last one, the 3D AI printing system for personal food production. That I think that we are considering the new platform by 3D AI printing system. Will develop the solution to reduce food loss by turning the unused food material into long life. It's a long life is important, not just 1 year, but 2 years, 3 years. Then you see the food loss can be reduced quite much. And because of the all the time, the delicious consumption. So you see that if the food is not delicious, no one want to have. So those, I think that it can create the 3D AI food printing industry. That I think that we may expect. So I think that this is something general idea of what we are going to do. And this is, I think, thanks for your kind attention. Also, those Professor Chiba is president of the Tokyo University of Agriculture and Technology. He's a program director, and it's very good for his leadership. And also the president of the NALO, the Dr. Kazuo Kuma, also helped a lot. And of course, this is a budget organization, the Bio-Oriented Technology Research Advancement. So that is my talk. Thank you very much for your attention.
Thank you very much, Professor Nakajima, for your very impressive but challenging, moonshot R&D programs. I would like to continue for the last two speakers in our session, which is the Dr. Susana Socolovsky, PhD in Chemistry, University of Buenos Aires, the past president of Argentine Association of Food Technologies, and Dr. Roger Clemens from School of Pharmacy, University of South California, Fellow of the American Society of Nutrition, immediate past president of International Academy of Food Science and Technology. So they will be talking about the food processing saves life. Now, who will be first? Susana first or Roger first?
I'm going to go first, Arabon. Thank you.
Okay, please go ahead, Roger.
How's the slideshow? Okay.
Yeah, it looks good. Just full frame.
How's that?
Yeah, fine.
Good. And my colleague down in Susana Socolovsky, we've been friends for a very long time, and she's down in Argentina today. Thank you for the opportunity to be with you today. I really appreciated the dynamics of the presenters thus far. They're addressing very important issues. I trust that as we look at the international opportunities, that we'll actually will hold hands and take action on the issues that have been presented so well. Those of you who would like a little bit more information on the alternative proteins that were addressed in part by Dr. Mathys, I will actually be speaking later this week down in Melbourne, Australia, about a topic on alternative proteins for the future and looking at some medical and clinical issues that are associated with those proteins. But right now, let me turn the slide over to what we're doing here. We often will say, well, they have lies, damn lies, and statistics. So often the public does not understand statistics. As indicated by Dr. Neufeld earlier today, it's really incumbent upon us to understand our audience so that they begin to understand what we're discussing. Much of the science today is really a different language. And so we need to understand the audience so we can communicate effectively and so that they can learn about the stuff that we're talking about. Importantly, we want to talk about these kinds of issues. Remember that at least here where I speak at USC, we realize that many do not have an adequate background in nutrition, and it's certainly the areas that have been addressed so far. We're not training people how to critically think. The media usually gets it wrong. And I'm reviewing papers now that clearly it's all wrong. Well, we really need to stimulate critical thinking. So I mentioned earlier today about evidence-based, which we support, but it's the quality of that evidence and the quantity of that evidence and the spectrum of disciplines that we really need to grasp. Here's a fun slide. Often you see in the news outlets and even publications that association. Well, association for consumers means causes. And this is a fun graphic here that shows the relationship between ice cream sales and shark attacks. Of course, it's nonsense. But people think, well, if you eat ice cream, you're going to get being attacked by a shark, well, or the other way around. But we have to be very careful what statistics are really going to show us. But where my passion really is, the countries that have been represented so far today, there's very few countries in the world where I haven't been working with the underserved population of the world. And that's where we're living today. If I can get my next slide to go down. There we go. I say processed food saves lives. Why do we process food? Well, we do that for a couple of reasons. One, to make sure that the food is safe. And I'll give you an example of pasteurization milk, which has been around since Louis Pasteur, of course. We want to make foods that are palatable. This was emphasized by several of the speakers thus far. We want to be certain to improve bioavailability. And part of that bioavailability depends on how it's processed, when it's seasoned, it's grown, and the type of packaging that it actually has. Importantly, during that process, we also remove a lot of toxins. So we want to take fortified foods and look in terms of public health issues. A really nice presentation just moments ago about the challenges in parts of Africa where I've spent some of my life. And I realized there's some challenges there, but it's just not so much adding nutrients too, but we have to be certain that in fact, the nutrients that we're adding there are biologically available. And lastly, an excellent point that was raised by a number of speakers today, that we'd be certain that we're not only sensitive to culture, dynamics of diets, but also that in fact those foods are going to be affordable for that environment. Well, what does nutrition really tell us in the scheme of what we're discussing today? Well, we have fat-soluble nutrients, and sometimes fat-soluble nutrients are actually better. And we see fruits and vegetables that have been advocating, but the important part here that processing actually improves the viability of many of the fat-soluble nutrients that we're talking about, such as vitamin E and vitamin A. And A is one of those international global nutrients identified by WHO that we need more of. And that was indicated by one of the slides earlier today. We also want to show that, there we go, processed foods contain better nutritive value, but some cultivars are different. And so we have to look at the type of foods and the various cultivars that we want to have to improve nutrient. Tomatoes, for example, I just rode a bicycle a long distance just a couple of days ago, and I went through a field of tomatoes, but how the process actually releases lycopene, which for some research indicates that reduces the risk of some forms of cancer. And the antioxidant capacity, ORAC has been examined for many years, but actually has no clinical value. So fortunately here in the United States, that's been removed for consideration. But we really need to understand the dynamics of antioxidants, not only in food, but also our normal health supply that we have in our own bodies. Well, there's a lot of benefits of the food supply system. And some of the benefits are laid out here: food availability, affordability, freedom of choice, and improved nutrition. We understand, because I teach toxicology, we understand that some processing actually improves the nutritive bioavailability, therefore, and at the same time, it reduces a lot of the innate toxins. Yes, toxins do occur naturally. It's not what nature puts in it, it's what nature put in there, but not what man put in there. So 99.9% of all toxins occur naturally in food. So we need to understand those dynamics as well as the nutritive value of the foods that we're going to be processing and ultimately consuming. Well, just a few more slides here so I get to my friend, Dr. Socolovsky. We see today nutrition toxicology and food technology has really enhanced a lot of attributes. Some of the products you see on the left-hand side of the screen, my friend and I co-authored this paper a number of years ago with Johanna Dwyer, who's the NIH Office of Dietary Supplements. And the potential benefits of that application. Iodine, one of the major nutrient deficiencies of the world. We know that we can eliminate goiter, which is very prominent here in the United States almost 100 years ago. But that's because iodine was added to salt. And we know that over 60 countries in the world have salt that requires to have iodine up to 100 parts per million. But what if we're removing that salt from the source? Because we're concerned about hypertension, only 7% react to that. What about iodine deficiencies of the world? Do we want to see goiter again? I don't think so. We ought to look at a lot of very opportunities here on the left-hand side. Allergenicity. We see that even some of the novel proteins that are being discussed today are actually allergenic, and I'll be discussing that more later this week in Melbourne. The idea of various forms of probiotics, could they be beneficial in some forms of gut? I did that work at Johns Hopkins 30 years ago. And so what the gut microflora may do in various cultures of the world may make a big difference in terms of viability, particularly when you're trying to refeed the malnourished child of the world. And a few more slides. And medically speaking, there are medical foods that are processed, the military foods that are processed. I was in the military, served in Korea. Foods that go up into space or have to be processed. I work with because I work with impoverished populations and malnourished children. Rehydration solutions, the fundamentals are processed so that they can be rehydrated with the proper electrolytes and so forth. And of course, pumping up, which is very popular in various parts of the world, is processed to provide better nutrition so people can regain their health. And a couple more slides. Importantly, here we see processing actually enhance the quality of the food. It enhances the quality of food because it's removing some toxins that are innate to these foods. The foods are indicated here on the left-hand side. Toxins are indicated in the middle row column, and how it's processed there on the right-hand side. So pick your favorite one, from potatoes to raw eggs, to seeds and celery and quinoa and carrots. They all have toxins in them, but these toxins occur naturally, and many people don't think about these attributes. But processing actually eliminates those, or it denatures them or inactivates them. So in fact, we actually have a safer food supply because we actually going to process the food. And a couple more slides here. You'll see here, as I mentioned at the very beginning, we have a call to action. We have a call to action by people in the industry, people in government, and people in academic, and people who are actually consumers. And we're all consumers. Working together, we can make a difference through all these attributes that you see here. Consumers want more information, but let's give them information they can begin to understand. And part of that understanding comes to understanding the fundamentals of food processing, the fundamentals of agriculture, the fundamentals of regulatory environments, the fundamentals of toxicology. You get the idea. And just as last speaker from Japan, the fundamentals of 3D printing. There's an emerging technology. It's interesting that people accept technology innovations virtually across the board, except for when it comes to food. We need to look at that more carefully. And lastly, I have, here we go. Here we are. So whatever the healthy diet pattern, Dr. Neufeld, he said a really great phrase here. Well, it depends. And that's where I certainly stand here. We want to understand the dynamics and cultural dynamics and history of different populations of the world. So that fact, where it can be healthy for individuals, we can make a difference through food processing. With that, I quickly turn over to my friend and colleague, Dr. Socolovsky. Dr. Socolovsky.
Thank you, Roger. Thank you very much. I would like to share my screen.
You can do that. Thank you, Susana.
Thank you. Okay. So thank you very much to the organizers of this international meeting for the opportunity to share with you my thoughts in regards to processed foods. First of all, I would like to inform you of the situation that we are currently going through in relation to food front of pack labeling in the Latin American countries. As you can see, in most of the Latin American countries nowadays, there are warning signs, warning labels on processed foods. Some of the countries have already implemented these regulations. Some countries have not yet implemented the regulations, as the case of Colombia, Brazil, and Argentina. So the food supply now looks like this. So there are shelves with packages that bear warning signs. And some categories, all of them, have these warning signs. So as you can see, at a publication that was done prior to the implementation of the warning signs law in Chile, it was estimated that 83% of packaged foods would have at least one warning label. So this situation started when the Pan American Health Organization introduced the NOVA classification of foods in 2015, and it adopted the name of ultra-processed foods and concluded that the association between annual sales per capita of ultra-processed foods and the increase of body mass index was able to predict obesity. So many documents were published since then, among them the PAHOS nutrient profile model, which recommends protection and promotion of unprocessed and minimally processed foods and freshly prepared dishes and meals made from these foods, and identifies the types of ultra-processed foods products whose sales should be restricted by regulatory measures. So let's take a look at the food processing-based dietary guidelines. As early as 2014, the dietary guidelines for the Brazilian population read, limit the use of processed foods, consuming them in small amounts as ingredients in culinary preparations or as part of meals based on natural or minimally processed foods. The ingredients and techniques used in the manufacture of processed foods, such as vegetables in brine, fruits in syrup, cheeses and breads, unfavorably alter the nutritional compositions of the foods from which they are derived. And also it read, avoid ultra-processed foods. As a result of their formulation and presentation, they tend to be consumed in excess and displace natural or minimally processed foods. Their means of production, distribution, marketing, and consumption damage culture, social life, and the environment. So soon after, at the end of 2016, the dietary guidelines for the Uruguayan population was published. Also, it read, avoid the consumption of ultra-processed foods. It went to show that in several drawings that the number of food additives defines an ultra-processed food. Take a look, for instance, at this chocolate milk. The chocolate milk has a longer list of food additives. So the Peruvian dietary guidelines for also announced protect your health by avoiding the consumption of ultra-processed foods. And also the Ecuadorian dietary guidelines showed that foods that bared a traffic light should be avoided. So all processed foods should be avoided if they had a package information as a traffic light. So as you all know, the NOVA food classification calls for 4 levels of processing. And according to the NOVA classification, the ultra-processed food products are of very low nutritional quality, are hyper-palatable, and quasi-addictive, among other things. So, are all ultra-processed foods of very low nutritional quality? Well, here we have a study by a group of Canadian researchers that show that results support previous research demonstrating that virtually all packaged food is processed to some extent, and products are not simply healthy or unhealthy based solely on whether they have been processed. For several food categories, products processed to greater extents had similar or healthier calorie or nutrient densities than products in lower processing classifications. And they also state, these findings demonstrate that calorie and nutrient dense foods exist across different levels of processing, suggesting that food choices and dietary recommendations should be based primarily on energy or nutrient density rather than processing classification. Now, a recent paper by Didery Tobias and Kevin Hall, which calls to reasoning about should we eliminate or reformulate ultra-processed foods, And it says, it reads, uniformly reducing all ultra-processed foods. Uniformly reducing all ultra-processed foods, the heterogeneous food categories that now represent 67% of total calorie per day for US children may not be an appropriate public health goal and may even have unintended harms. Drastically reducing or eliminating the availability of all categories of ultra-processed foods without simultaneous consideration and efforts to replace them with better, affordable, and practical alternatives should be scrutinized. Eliminating ultra-processed foods that deliver on many desirable properties. They are inexpensive, microbiological safe, they have been nutrient fortified, have extended shelf life, and convenience may only worsen the existing disparities in food insecurity. And he says the broad NOVA classification system may be too blunt to guide public health responses to pressing epidemics such as obesity. So another question we need to ask ourselves, are ultra-processed foods hyper-palatable? Are ultra-processed foods the only foods contributing to excess calorie consumption? Now, a recent study by Teo and collaborators published in the Journal of Nutrition has studied a very large number of typical foods and dishes in Singapore. And they have concluded that the findings show that taste-nutrient relationships are maintained across different degrees of food processing. Despite the suggestion that processed foods are hyperpalatable, currently there is no evidence to suggest that heightened palatability due to sweet or salty taste makes a disproportionately larger contribution to daily energy intakes. The current findings showed no association between hyperpalatability and ultra-processed foods consumption, as has been suggested and critiqued in the past. And today, there remains no empirical evidence from clinical trials for a disproportionate contribution of specific taste of ultra-processed foods in promoting excessive daily energy intakes. So let's see what the regulatory agencies, some of them in Europe, have to say in regards to ultra-processed foods and their impact on consumers' health. This is a report of the Scientific Committee of the Spanish Agency for Food Safety and Nutrition on the impact of the consumption of ultra-processed foods on consumers' health that was published on May of last year. And it says, the proposed definitions have been the source of some scientific dispute, as some definitions refer to the type and degree of processing foods undergo, while others refer to their formulation and composition. In this regard, it is important to remember that one cannot attempt to relate the degree of processing with an effect on health independently of the composition of the food. It is also important not to associate the term ultra-processed with foods of poor nutritional quality, as this does not depend solely on the intensity or complexity of processing, but the final composition of the food itself. The ultra-processed characteristic is attributed to the fact that the food contains additives. Its inclusion alone cannot be linked to a nutritional damage. Let's see what the French agency has said. ANSES has concluded that there is a lack of clarity on the concept of ultra-processed foods. The impact of ultra-processed foods on health seems to be more linked to their composition than to their degree of processing. Ultra-processed foods should not be automatically linked to poor nutritional quality. And it ends, there is no need to wait to find out whether or not the concept of ultra-processed foods is relevant to discourage the consumption of foods high in fat, salt, and sugar. So what is our task as food scientists in this scenario? We need to emphasize the importance of cultivating public understanding, not to apply blanket definitions to foods based on processing, to communicate that it is the overall nutritional composition of food that counts towards making healthier diet choices, and that the ultra-processed food concept should not tarnish the reputation of processed foods. As we all know, there is a revolution on the way nutrients are being produced, as we have heard. So avoidance of derogatory concepts about processed food is needed urgently, and education of the consumer is paramount. Thank you very much for your attention.
Well, thank you very much, Professor Socolovsky, and I thank also Roger Clemens for excellent talk, particularly clarifying the misconception that exists for the ultra-processed foods and defining exactly processing is not necessarily something that we should avoid. And obviously, this clarifies the myth that has been going around for a long time, that processing is bad, while we know a lot of advantages of it. Obviously, junk food and ultra-processed food cannot be equated. And with that, I thank you both.
Thank you very much.
As they said, Alfredo, thank you.
Okay, so I hand over to the break. Thank you very much, Susana, and also Roger. Excellent presentation.
Thank you, Iman. Thank you, Susana. Stay safe.
Thank you, Roger. Thank you, everyone.
It's good to have you back after such presentation from IUFoST. And I'm sure we have all been educated from that angle. We now go on to the IUNS session, where we'll be looking at the sustainability of nutrition, sustainability for nutrition and health. And here I have 4 great speakers who will be going on a marathon journey within the 1 hour that we have. I'll start off with the first speaker, who is Dr. Robert Fungo. Robert Fungo is the Vice President of FANUS, the Federation of African Nutrition Societies. But for his day job, he's a lecturer at the Makerere University in Uganda and has been affiliated with various organizations such as the Alliance for Biodiversity International and the International Center for Tropical Agriculture. He has also been affiliated with FAO, CIFOR, and other organizations working in lower and middle income countries. It is my privilege to invite Dr. Robert Fungo to give us his talk on agricultural biodiversity for better nutrition, health, and improving livelihoods in sub-Saharan Africa. Robert Fungo, over to you.
Thank you so much, Francis, for giving me this opportunity to present some of the work I've done the last 10 years in West Africa and some parts of East Africa. My talk will be focused on how the agricultural biodiversity contributes to better nutrition, health, and improved livelihoods in sub-Saharan Africa. I just want to start with some of the definitions of some of the terms that may not be known to some of the participants in this meeting. Agrobiodiversity simply means the variety and the variability of animals and plants used directly or indirectly for food and agriculture. The second definition I want to share with the rest of us here is the dietary diversity. Refers to the number of unique foods consumed over a given period of time. And then nutritional status is the condition of health of a person that is influenced by intake and utilization of nutrients. Often, a lot of scientists assume that the interlinkages are obvious, which is not true. And there's more to that. I want to use 2 case studies. All of these 2 case studies have been involved deeply in implementing these projects to make my case why agrobiodiversity is important to improving nutrition and health. The first case study is the project that I worked on in Benin, in West Africa, South Africa, and Kenya, where we investigated on how the leafy vegetables in Africa are important to human health. And the second case study is the recent study I worked on in Cameroon, DRC Congo, and Gabon, how forest foods contribute to nutrition and health. Over time, these foods have been overlooked by research and policymakers, and the government rarely allocates time and resources to these 2, into the forest foods and indigenous African leafy vegetables. The first case study is I worked with a team in West Africa, Benin, South Africa, and Kenya. It deployed the multidisciplinary but also transdisciplinary approach. Researchers from different fields, nutrition, socioeconomists, and botanists, cutting across from different fields. We work together with communities and decision makers to implement this project. Also, we considered gender mainstreaming along the process of implementing the project, and the capacity building along the value chain along the value chain, during the production, the distribution of the vegetables by the traders, also the consumers were considered along the way. And of course, there was monitoring and research at all levels. Basically, this study was a longitudinal study, and we had the intervention and the non-intervention sites. At the end, we were interested in influencing the policies that are supporting improving health and nutrition, tapping into the leafy vegetables that are consumed in Africa. Basically, for those who don't know Africa very well, Africa is a continent. We have several countries, and one of the countries that I worked in is in Benin. It's located there in West Africa, Kenya in Eastern Africa, and South Africa. Some of the results for that case study, here I present when we introduced the leafy vegetables that had been abandoned by the communities in Kenya. In 2009, there was none, we recorded none, no community that had got this, were planting these leafy vegetables. By then we sourced these leafy vegetables, the African nightshade, Corollaria, hibiscus, from the World Vegetable Center in Arusha. And we collaborated with them, and then we introduced these leafy vegetables in 2010 in communities in a place called Makueni, just outside Nairobi, along Mombasa Road. And by 2011, we went back to check. We realized that in our intervention sites, the leafy vegetables had been adopted and were being planted. But also, we noticed that there was a spillover in the non-intervention sites, because we were promoting these vegetables alongside the nutrition education sessions were being conducted in communities. So they got the information and went and picked the vegetables from the sites that had been introduced to. Okay. This slide simply shows the period over time when we introduced the vegetables, the African leafy vegetables that had been abandoned by the communities, and how they were being adopted how they were being reflected in the market. So around 2009, December, November, we introduced the seeds. The seeds were distributed to the intervention sites. And over time, as we checked the market, the sales and the supermarkets, we realized that these crops were being picked up, and the number of sales were quite high and the volumes were high as time went on till 2011. Overall, in Kenya, this was in Kenya, there has been a steady increase in marketing of the local vegetables, the amaranthus and the African nightshade in Kenya. Basically, this is the evidence we had after time in the last year. The final stages of the project, 2011. This was taken in the market in Nairobi, and the African nightshade was quite highly sold by the traders. And then the food, the vegetables, the indigenous vegetables found their way on the shelves of the supermarkets in Nairobi. And also, you can see women were fully engaged in the business. So that was an impact we created in Nairobi and Kenya. This slide reflects some of the findings in South Africa. The risk factors, it just simply shows the risk factors of the cardiovascular diseases among the consumers and non-consumers of African leafy vegetables. Our finding, some of the variables that we measured, the blood pressure, cholesterol level, serum, iron serum, and BMI and waist circumference. what I want to share with the participants here is that we realized that there was no significant difference between the consumers, I mean, the intervention and the non-intervention sites. And then we took it further to analyze, to find out if there was any significant difference between the rural settings and urban settings. And our data revealed that when we compared the urban and the rural settings that were consuming these leafy vegetables, some of the risk factors were higher in urban populations. As you can see, the waist circumference was quite high among our respondents in urban settings. And also the blood pressure was quite high among the urban population compared to the rural settings. The second case study that I want to share with you to make my case is the study we did conduct in Cameroon, DRC and Gabon. And it was just basically trying to prove that forest foods can contribute to food security, nutrition and health of forest-dependent households. And this study ran for 5 years, from 2010 to 2015, and was being supported by the African Development Bank. But for this sake of this session, I will make a case for, I'll use results for the first objective of the study, to establish the contribution of forest foods to dietary intake, nutrition status, and food security. There are other objectives which I will not talk about. Okay, the first slide simply shows the food security, how food security is affected by, among the consumers and non-consumers of forest foods in the 3 countries that I mentioned earlier. Basically, there was high food insecurity among non-forest consumers. For those who have been to Central Africa, forest foods are very important, but there's high food insecurity among the forest food consumers in those countries. And here we had a high, severe food insecurity of about 68% among non-consumers of forest foods. This is a matrix for correlations and a matrix for correlation of food security indicators of forest food consumers, forest communities of the 6 concessions in Congo. Our data was drawn from populations residing around forestry concessions that were allocated by the governments in those regions to foreign companies to extract timber that were exporting to China and the Western world. And we believe that because of the forest concessions, the effect on food security was high. So we did take some measurements, collected some data on household data diversity score, forest food consumption scores, food variety scores, and then the food security score was also computed. And then when we ran the matrix, it was found out that there was a significant and a negative correlation with the forest food consumption score with food insecurity. That simply means that households consuming forest foods were less food insecure, and also there were weak positive correlations between the forest food consumption score and food variety score, and that implies that that consumption of forest foods increases data diversity and food variety. It was something that was of a revelation. And that took me to the next slide, where we went further to compute the nutrient intake nutrient intake from the forest of foods and non-forest of foods in Cameroon. This slide is from Cameroon study and has been published in Public Health Nutrition. Basically, we did compute for the various nutrients, and we compared that with the RDA, the nutrient requirements for women. And we separated this into the forest of food consumers and non-forest of food consumers. Basically, our findings they revealed that forest of foods were contributing high intakes of more than 60% of vitamin A and E and C, including the minerals iron and zinc and sodium. The findings are quite clear here. The percentage below, or I mean, the percentage of women who are receiving below the nutrient requirements were, we could see 21% for vitamin C, meaning that 80%, almost 80% of the women who are consuming forest of foods were getting the vitamin C that is required for them to have a healthy body.
Our time is fast spent. Begin to round up, please.
Yes, please. I'm about to finish. This slide shows the food groups and how they are contributing towards the intake of vitamin A, iron, and zinc. And of course, this is also separated. I mean, we have two categories: forest of food consumers and non-forest of food consumers. And this was work done in Cameroon as well. It revealed that vegetables, of which most of it was sourced from the forest, were significantly contributing towards vitamin A. Almost 76% of the requirements of vitamin A were got from vegetables, which were mostly sourced from the forests. Also, the iron, which is very important, about 36% was got from the forest, and zinc 24%. This slide, yes, this is it shows the estimated nutrient contribution of the average daily nutrient intake to the dietary recommended intakes for children and women. And this is a slide from our study that was conducted in Gabon regarding forest of fruits, and how they contribute to the dietary reference intake. This study simply shows that forestry foods contain high nutrients in them that can address micronutrient deficiency and also mineral deficiency in the communities that consume the forest foods, if they are consumed in adequate amounts. In conclusion, the two studies that have participated in, we realized that the different agrobiodiversity that is sourced, I mean, can be a source of income, and it can be found in markets, even in urban areas. Income of farmers who are the producers of these crops could be improved if they are linked to markets. As a result of high incidence of food insecurity, as you saw in one of the slides, among the consumers of these foods, food and nutrition insecurity is not alleviated by access to a large number of nutritious indigenous vegetables and forest foods. However, those who consume forest foods and fruits can obtain substantial amounts of these essential nutrients. And the last is a recommendation: urgent action is required for the promotion, domestication, and conservation of some of these foods that have not been taken serious by the governments and the donors. That is all, Francis. Thank you.
Thank you very much. Stop sharing. Our next presenter is a person I call a scientific mogul in nutrition and food science. Professor Lynnette is a distinguished scholar with several awards. She's currently a professor of nutrition at the University of Ghana, having been the past or immediate president of director of nutrition at the FAO, and also the past president of the International Union of Nutritional Sciences. I could go on and on, but I would want to give the time to Professor Malati for the next 15 minutes to share with us process revolution and malnutrition. Thank you, Anna.
Thank you very much, Francis, for the introduction. I'd like to go straight to my presentation. I'm trying to get it in sorry. Okay, so I thank IUNS for inviting me for this presentation. And I'll say that my presentation somehow is a good follow-up to what was given by Professor Roger Clemens and Dr. Socolovsky on processed foods. So I'll be focusing on processed foods in sub-Saharan Africa. But before I go on, IUNS is celebrating 75 years of existence. I congratulate them. And I'd like to remind IUNS that at the time it came into existence, just around that same time, another big global organization, which is the Food and Agriculture Organization, was also born around that same time, just a year before. And at the time, what was actually a pressing issue at the time was hunger and malnutrition. There were major concerns then. And to actually prove that, the first Director General, Sir John Boyd Orr, was a renowned nutrition scientist who was nominated to lead that organization, the Food and Agriculture Organization, basically to address these pressing issues of hunger and malnutrition. And he was then doing a lot of research on the quality of diets and also issues related to poverty. Now, with that, where are we today with respect to the nutrition situation? Now, over the years, we managed to gradually reduce the prevalence of hunger, gradually coming down. But then it's picked up again in 2017. And then we see a big jump in 2020. 2020 saw the biggest increase in the numbers of hungry people ever reported in 50 years in 1 year alone. And here, about 180 million more people in 2020 than in 2019. And we see the situation in sub-Saharan Africa. You can see that it was a big jump of numbers of hunger from 219.8 to over 264. Clearly, the effect of COVID effect. So COVID actually pushed us back in meeting a lot of the global nutrition targets. Now, if you look at the nutrition targets that have been presented in these graphs, and you look at where we are currently and where we want to go, that you see that unless we do something drastic, achieving the global nutrition targets by 2030 will be a big challenge. Currently, in 2020, we have about 22% of the world's children who are stunted, 6.7% wasted, and 5.7% overweight, and 30% of women of reproductive age who are anemic, who were anemic in 2019, and the numbers would go up as a result of COVID and the intervention measures. To see how much COVID is actually aggravating the nutrition situation, I'm presenting here work that was done by the Standing Together for Nutrition Consortium. Okay, they assess the impact of COVID looking at 3 scenarios: the optimistic, the moderate, and pessimistic. So they're looking at how in COVID, looking at taking various things into consideration in this modeling, looking at the impact of COVID. Now, initially, for a short while, but we are in 2021, at the end of 2021, and COVID continues to exist. And so they are recommended we should be looking at the pessimistic scene, not the optimistic scene that was predicted in the early half of 2020. So now what we'll be expecting is that these are going to be additional numbers due to COVID effect. Wasted children, we are going to see about 13.3 million, stunted children, about 3.6 additional children, child deaths 283,000 additional, and then maternal anemia 4.8 million additional as a result of COVID and COVID and its effects, and the measures that have been put in place, some of which are actually causing harming nutrition. Now, another thing we need to address is that 75 years ago, healthy diet was a problem. And that's why malnutrition and hunger were problems 75 years ago. Today, it still continues to be a problem. An analysis that was done by the SOFI 2020 showed that 3 billion people cannot afford a healthy diet. And when you look at the map here, you can see where they are really located. Majority of these 3 billion, you can see a lot of them in countries in sub-Saharan Africa. Another global concern that has come up since 75 years ago is the issue of rising overweight and obesity prevalence. You can see from the trend of the lines on this graph that no country or no region has been spared. Overweight and obesity is rising in all regions, even in sub-Saharan Africa, which has a high burden of undernutrition. Now, the rate of increase of obesity in sub-Saharan Africa is very fast. So if you look at the trend, even though we still have low numbers, in terms of the rate of increase, it's really very, very fast. So one could ask, a continent that has a high burden of undernutrition, why is it then also experiencing increasing rates of overweight and obesity? And it's with this in mind, when I was director of nutrition in FAO, we commissioned a paper to actually know and look at the food systems drivers in sub-Saharan Africa. And one of the things that keeps coming up is, processed food. So we the study zeroed in on the processed food revolution in sub-Saharan Africa and how this could be related to the double burden of malnutrition. The work was led by Tom Reardon and Barry Popkins, and it has been published. So I'll be reporting on the findings of the study. So the study really confirmed that indeed the double burden of malnutrition exists in sub-Saharan Africa. So if you look at the situation about 20 years before and 20 years later, so you can see this is in the 1990s, and this is after 2010s, what the situation for stunting is. You can see some decrease, wasting a little decrease, thinness, some decrease, overweight and obesity, really an increase. And this chart shows really the direction. You can see that the bar is bigger for overweight and obesity, especially in adult women. The rate of increase is really, really fast. Okay, so the change in nutritional status within 20 year time span, you can see where the direction in which we are going. So the study said that the prevalence of undernutrition is declining. That is declining from the high level, even though we have low prevalence of overweight and obesity, that is rising rapidly to a significant level. Also, although overweight and obesity is still more among higher SES subpopulation, there's a shift towards the lower SES. So it's not the high socioeconomic group concerns. It's now getting also into low SES group. And also the double burden is fast rising even among the poorest countries in the region. You can also see this problem. Now, this map shows clearly that the double burden of malnutrition is here in sub-Saharan Africa. You can see clearly. Here on the left map, on the left side of the map, you see that the shading is lighter and in the 1990s. When you come to the 20s, the shading is deeper. The deeper the shading, the more it tells you that we are going deeper into the overweight and obesity, more than 30% and more than 40%. And at the same time, you see that more countries are getting into this situation compared to the 1990s. So really, what is pushing this? So possibly, it's possible that the recent changes in food systems could be a driver for the double burden of malnutrition in sub-Saharan Africa. And very often we are looking at possibly processed food. Could be a culprit in the region. Well, the study looked at the situation from the food supply side and also from the demand side. Now let's look at from the supply side. One of the things that's happening fast in sub-Saharan Africa is that we see that urbanization is fast happening. If you look at the situation, you see that 1990, the urban population in sub-Saharan Africa was about 200 million. In 2018, we have more than doubled. So that's what's happening. And when you have people moving from rural areas to urban areas, you see that there's a change in diet. There's a change in diet, and among the diets also happens to be, they tend to depend more on processed foods. There's also a change in the food environment where supermarkets are available, and also there's the influence of food advertisement that's really encouraging people to shift to certain types of diet. Then the second driver of the situation in sub-Saharan Africa is the income growth and employment shifts. So here you see that income in sub-Saharan Africa has tripled in the past 2 decades. And these are the figures that the publication reported. You can see that where we are in 1990 and 2018. So as income increases, also people can also shift and change in their diet. Another factor is employment outside the home. People are moving from working on farms, agricultural lands, and are taking employment elsewhere. And this also is shifted by the urbanization situation. So people are moving outside the home with new kind of jobs that they are doing. Then also the privatization of agri-food sector and the liberalization by government. Now, this led to proliferation of small and medium enterprises moving into food processing. This is not bad, you will see. This is not bad at all. I mean, it's income generation for them. They are moving into an area where the consumer needs service. And we'll talk about that in a minute. This also led to the importation of highly processed foods, some of them sugar-sweetened beverages and all. Then also there's the improvement in infrastructure, roads, electricity, these are expanding. And so it made it possible that processed foods do not only stay in the urban areas, but now they are also moving into the rural areas. And these were all came out in the report that has been published. Another important factor that came out is the purchase of food away from home. Food away from home also the increase as a result of employment, people taking employment outside the traditional employment of farming, especially for women who have moved away. And so issue of time and convenience became a very important matter for them because, they could not spend hours preparing food. As you know, typical African food, you can prepare, you need about 2 to 3 hours. So we have processing, they are moving to more convenient and time-saving processing that will help them. So this is very important. Now, this graph from that and the study that was done show that people are eating away from home. More, because they are taking on other employment, we see food consumption away from home become more. And you see that in several of the African countries, you see where the direction of the graph is going. This is because time and convenience has become an issue. It's much more easy to just go on the street or go out and buy your food rather than come and spend all this time to cook and spend, and even the commuting to your employment and back could take you about 3 hours because of heavy traffic and all. So away from home, food away from home has become very, very popular in many African countries. Then another issue that is happening is the quiet revolution in processing in Africa, which is actually leading this, is the proliferation of SMEs. There's a spread of SMEs. They see a need, the consumer has a need because of time constraints and convenience. And so they've come in helping to process some of the foods so that it will reduce the heavy burden on it. So we also have food service sectors who are selling also highly processed foods. Processed foods are sold in small local shops and also in the retail market. And there's an expansion in the retail market to the point that the local shops actually make up about 90% of the retail markets. Also, the spread of supermarkets in sub-Saharan Africa. Yes, supermarkets are coming in, they are increasing, but again, the study found that supermarkets hold about 10 to 20% of the urbanized processed foods, but actually our traditional sector, small, medium enterprises hold about 80% of the urban processed foods, urban processed foods.
No, you have 1.5 minutes.
Now let's see how processed foods are helping us. Really, they actually are, this food we prepare in Ghana, it's a very tedious process. But now we have local industries coming up with a flour that is helping us. And now we have small equipment that you can process this food and get your product, you know, without going through all this tedious process. This is a product we have in Ghana. If you really want to process this food, it will take you 1 week. You have your dry maize, you soak it for 24 hours, get your fermented product, ferment it for three days, and then you get your product, prepare it. And to get this, you are talking about 1 week. Now, you know, processing has made it possible, reducing time and effort. So now you can buy your flour and then you get your product. Now, other processed foods are coming up, sugar sweetened beverages. And you look at a lot of the local, even some of not only the supermarkets, but also the local small shops. And this is what you see. A lot of them have a lot of these highly processed foods, especially sugar sweetened beverages that are coming up. And the value chain for these have been so well refined, where they're actually delivered to the shop of the vendor. It goes straight to the shop of the vendor. So it's so refined. But you don't see this for some of our fruits and vegetables. And a lot of advertising around in terms of some of the products, to the point that some of the unhealthy foods are so cheap. And the ones that we want people to consume more of are so expensive. So this, again, is also a big problem. So the study concluded that yes, the double burden of malnutrition, the double burden exists in sub-Saharan Africa, possibly linked to rapid growth in the processed food consumption. But processed food is here to stay. And it started over 50 years ago when people started changing their kind of the jobs that was being done. And the drivers are the cost in time and convenience that we want. They are cheap. The income is also driving it, and also the changing food environment. Processed food has both positive and negative sides. And I think the presentations earlier show this, that the positive sides are the time saving, convenience, livelihood, the safety aspect, which has been mentioned, and also the shelf stable. But I think the negative side are the parts that actually result in reducing the nutrient content of the food. And that is what we should be looking at. Those are the ones that have deleterious effects that we should actually be looking at. And so in terms of policy action, I think that policymakers should look at, not saying that processed food are bad, no. Look at the ones that are actually affecting the nutrient content. And that is where we should put energy on to discourage their consumption, but we should actually promote processed foods that are nutritious. We have just had the Food System Summit, and the Food System Summit came out with special messages that food system transformation is critical to really achieving the SDGs. And one of the overarching tracks is that we should be looking at ensuring access to safe and nutritious food for all. And I believe that nutritious foods and processed foods can contribute to this if we focus on processing foods to make them healthy. Okay, so on this note, looking at the time, I would like to say a big thank you for this opportunity. Thank you very much. I'll hand over Francis.
Anna, great presentation. Our next speaker is Professor Ridwan Haisha. He is a professor of nutrition at the Department of Community Nutrition in the Faculty of Human Biology at IPB University in Borneo, Indonesia, and also the president for the Federation of Asian Nutrition Societies. Without wasting much time, let's hand over to Ridwan.
Yeah, thank you very much for this doctor, moderator, and thank you very much to the President of IUNS and President of IUFoST, Prof. Prakash, and also to the President of IUNS. And also to my colleagues, all include Prof. Aman Wirakartaskusuma here, the next President of IUFoST. Allow me to share my screen for the presentation. Okay, thank you very much. Is this okay, my voice, sir?
Yes, you're okay.
Okay, thank you very much. My topic is sustained nutrition, health affordability, and climate goals. And the scope of this presentation, I divide on about 6 subtopics. I more focus on Asia and also one example for the Indonesia, my country. First, about malnutrition in Asia, and then the trend of NCDs and demand for food in, especially in Asia, and same data also from Indonesia, and the reality that Asians are getting life longer, even we are facing the malnutrition problem, and trends in the demand for food and diet, and then we discuss about nutritious, healthy, affordable diet, and climate goal. I focus is on the consume less emission food, and using organic waste for feed and solar energy. So in Asia, we are still facing a double burden of nutrition, but we are lucky that in the Eastern Asia, like Japan, Korea, the problem of undernutrition and stunting is quite lower. But the undernutrition and stunting mostly occur in developing country of Southeast Asian country, and also particularly selected East Asia country and South Asia countries. So the problem about the malnutrition in Indonesia, about nearly half, about 55% is combination of several undernutrition problem. And it can be seen here as Indonesia in the red color, still together with Philippines and Vietnam, we are still facing a problem of the one of the undernutrition called stunting, and the other Asian countries like China, Japan, Korea is better off in terms of nutrition problem, and some other countries also facing another side of nutrition problem like obesity, especially also in Thailand, Malaysia, and Indonesia also facing getting higher the obesity problem. So if it can be seen here how serious the problem among children, also anemic among pregnant women in Indonesia, is already published by UNICEF, joined together with the WHO publication. So the other side of the nutrition problem in Asia is about the obesity. Only few countries in Asia could maintain the prevalence of obesity, like Japan, South Korea, and Singapore. The other countries are increasing the prevalence of obesity, and in Southeast Asia countries, is neighboring country of Indonesia, like Malaysia, is the highest prevalence of obesity, and also our neighboring countries of Indonesia in the north part is Thailand. And some other countries, Cambodia is still lower, but some report also mentioned that the problem is increasing. And while increasing the prevalence of obesity, we know that obesity is one of the risk factors of the non-communicable disease. It can be seen here based on the Southeast Asia countries problem per 100,000 population of NCDs. Myanmar, Laos, Cambodia, include my country, Indonesia, Vietnam, Philippines, Thailand, and Malaysia, putting in the highest incidence of NCDs, prevalence of NCDs, while the two South Asia countries the developed countries in Southeast Asia like Brunei and Singapore, which is similar also to Taiwan and the eastern part of Asia and Japan and South Korea. And if calculated in terms of the daily, it can be seen here, the red color. It is the young red color, like Indonesia, also similar to China and India. We have a similar at the middle position of the problem of NCD in terms of daily. And what is the risk factors for the Asia? So the main risk factors about the dietary risk factors that we already discussed since the first session. What does it mean, the healthy diet? What can we apply the healthy diet, and before that, nutritious diet? Yeah. So dietary risk is the first rank of the risk of the non-communicable disease in Asia. The second one is high blood pressure. The third one is tobacco, smoking problem especially among the young adult and teenagers, and high fasting blood glucose. It is the first 5 risk factors. Besides, we are facing a problem of NCDs and obesity, while we are facing also a little infectious disease. In general, Asians are getting older, mean living longer and flocking to major cities. And more women also now working at the formal sectors, especially in the urban and suburban area. And because of the education is getting higher, and the age of marriage also getting higher, then the success of the family planning program of each of the country, the size of the family is getting smaller. This all affect on the lifestyle and consumer spending, both food and non-food goods. It can be seen here that in the East Asia, the growth of the population is getting lower, while in Southeast Asia countries, include Asian countries, is still getting higher, even it is after 2020. So East Asia, in terms of the growth, is getting better. In terms of the undernutrition, is getting better. In terms of obesity, can maintain, especially South Korea and Japan, in based on the data that I got there. And it can be seen here also that the prevalence of elderly, is getting higher from year to year. For instance, 2015 and only about 11% in East Asia, and now it was projected about 45 years, next 45 years will be 40%. The people is the elderly, the age of more than 65 years old. And in Southeast Asia is not as dramatically increased as in East Asia. In South Asia will be about 20% during the next 45 years for the elderly people. And especially in my country, Indonesia, the 10 top cause of death in Indonesia, stroke, ischemic heart disease, it will be different to East Asia, I think, which is kind of cancer, like developed country. But in Indonesia, is similar also to Malaysia, Bangladesh, and Thailand. The first 3 cause of death is a stroke, ischemic heart disease, or cardiovascular, and diabetes mellitus. And the risk factors, it is in line with the in Asia. It's not in line with the Asia and international risk factors. In Indonesia, the dietary risk, it is in the third, not in the first. In the first one is high blood pressure. Even we know that high blood pressure also related to diet, indirectly or directly. But according to the study done 2019, high blood pressure and tobacco, it means smoking, and dietary risk and blood glucose, it is the 4 highest risk factor for cause of death. And what is the trend in the demand for food and diet in Asia? It is based on the study by the Information Food Council, International Food Council information. in Asia, I think it is also similar to small study from several countries I read, and also in Indonesia. The first criteria to choose the food is about the taste. The second is the price. But for the particular social economic level, like for the middle up income level, helpfulness can be the first. Yeah, but in general, taste, price, and helpfulness is the convenience is the four reason for the people to buy a food. And during the pandemic, the study by IFIC also saw that in Asia that there is a change in food preparation due to COVID-19. Yeah, during the first year of the pandemic, cooking at home is more, I think, similar also to developed country, snacking more and washing fresh produce more and thinking about food more than you usually do. It seems like a daydream to get the food if they get the food and then they can eat the food. Yeah, so 85% change in any of the variables. Another studies by Presu 2019 before the pandemic. It is it's not only in Asia. It is a global study. So that again, the test include the appearance, the organoleptic or the sensoric test of the food is the first reason of the people to buy the food. It is similar to Asia, and small study that we did in Indonesia also like that. And by the Vita food, so that the trend, there are 7 trends of the nutrition area for the urban population. First, about the plant-based innovation, include plant-based food, and then keto-friendly product. It's called a friendly product. Actually, keto about the fat, about 80% energy from fat. And sport nutrition is for the seniors is getting popular. The image, the wording, the knowledge and sustainable nutrition also getting better. And fiber still increasing concern of the public, of the people, and then personalized nutrition. This all the 6 trends in nutrition by the Vita study in 3 countries in Asia. And we did a study together with Saskia DP, WFP program manager, and also several experts from US and Europe on nutritious and health affordable diet for the Indonesia. The study inspired by the Lancet article by the Harvard Harvard University expert, promote the sustainable diet with this kind of range for each of the food groups. While in the right side, it is the Indonesian dietary guideline called My Plate, or Indonesia called Isi Piringku, or in other country called My Plate. We try to analyze based on specific vulnerable group, whether or not with the less emission of food, we try to reduce a little bit the consumption of animal food, but still we need, because the anemic problem still prevalence in Indonesia, but not as the lowest quantity of the food as proposed in the Lancet. And the study by Saskia, me, and the other colleagues already published in the American Journal of Clinical Nutrition at the middle of this year. And the objective of this to compare the Indonesian food utilization to diet optimized for nutritional value and cost, and to diet that are increasingly plant-based in order to meet further health. Plant-based doesn't mean vegan, yeah. Plant-based still dominant plant, but still we suggest to consume animal food, animal-derived food, especially fish and egg, because it is the very cheap and affordable for the Indonesian context. So the method is we compare 30 dietary scenarios. We develop a 13 scenarios to the current one, 7 to optimize using a statistical approach and there are 3 increasingly plant-based and 1 eat Lancet. So the result is the diversity of model scenario was higher than that current consumption, reflecting nutritional deficiencies underlying Indonesian burden of different form of malnutrition. Nutrient intake target were met based by nutrient and cost optimized diet, followed by eat Lancet diet. So the optimized diet that we found is better to be applied in Indonesia compared to if we adopt directly eat Lancet diet. This diet also had lower emission, also had high emission, also less than 40% scenario in which Indonesia would adopt a typical high-income country's diet. So even we still suggest to have animal food, the meaning of high GS mean high compared to the eat Lancet diets, but it is lower compared to about 40% of scenario in the Western countries. So this is, for instance, we select for typical province Indonesia. East Nusa Tenggara is the most prevalent anemic and most prevalent stunting in the eastern part of Indonesia. We calculate how many rupiahs it is. 26,000, it is about $2. Yeah, it is about $2. 14,000 mean about $1. 13,000 about 95 cents. Yeah, it is the for the lactating woman. If we apply this sort of diet with this price, it is considered affordable based on the lower price that we choose in the study. It will reduce the problem of anemic is about nearly 50%. Among the adolescent girls, the price is a little bit higher here, about $2.5. That if applies this kind of diet will reduce our scenario about 16 to 35% reduction in anemic. And then since my presentation also include about the climate goal, but I try to limit only first about the consume less emission food. And the second one, using organic waste for feed, like black soldier fly, as already presented in the session 1 also. And then how to optimize solar energy, to use the solar energy. And this is one interesting meta-analysis based on Asian perspective. Yeah, in global study and in Western countries, the meat intake, especially red meat intake, will increase the risk of the cardiovascular disease. But this study, especially study among the Asian, using the Asian perspective core studies, so that the meta-analysis did not provide evidence of higher risk of mortality for total meat intake, and provided evidence and inverse association with red meat, poultry, fish, and seafood. So it's no problem as long as the quantity like what the people on average consume now, like this. In Asia, mostly the animal food come from fish, like Japan, Korea, South Korea is the highest one, about 50 to 60 kilogram per capita per year, while in other countries like China and Bangladesh is in the lowest part, yeah, also compared to US. Meat, red meat, yeah, in US is quite high. In Asia is only about 1/5. Maybe also the quantity is also a problem, or maybe some also discuss maybe the way to cook, yeah, or maybe also I don't know exactly, maybe about the application of ultra high temperature. Maybe you of the expert from the food technologies maybe can analyze that one. We haven't know exactly what happens. It is the opposite result from the similar study done for the developed country, while red meat is increasing risk of cardiovascular disease. So anyway, since we don't know exactly, but as long as we consume only in a small amount, about 20 gram or 30 gram of meat, we no problem, because fish is and egg is consumed more by the Indonesian and Asian people compared to the Western people, which consume more red meat than fish and other kind, include also tempe and for Indonesia, but also consume soybean. It is popular also within the Asian countries. So if we discuss about what we should suggest about the less emission of food, it depends on the local context here, because the way to produce the food, the way to transport the food also can be different, the emission. So it depends on what the country produce should have lower emission than the country export from faraway countries. Yeah. So it is just in general in the country based on the previous study done. So even if maybe in Western country is a high emission, but maybe in particular village in Asia.
We've got to move on. Thank you very much, Ridwan. Insightful, quite a lot to share, but I think that we've got to move on to the next speaker, and that is Ana Ramos, who is a nutrition officer at the Food FAO. And Ana has done a lot of work in Mexico and also in the University of Colombia. Without wasting much time, Ana, I don't know how you're going to do this, but you have less than 10 minutes. I'm eating into the break time. Please, over to you.
Thank you so much. Thank you so much to IUNS for this invitation. I am Dr. Ana Islas Ramos. I'm a nutrition officer at FAO, and today I will be speaking on sustainable healthy diets. What do we mean and how do we promote them? The outline of a presentation is the following. I will be talking about two main challenges of the 21st century: malnutrition and sustainable food systems. Then also about FAO and WHO sustainable healthy diets guiding principles. How do we promote sustainable healthy diets and what is next? So regarding the first aspect, I think Ana, who preceded me, already looked at these data, but again, global hunger increased under the shadow of the COVID pandemic. The pandemic heightened the challenge of eradicating hunger. Nearly 2.4 billion people in the world lacked access to adequate food in 2020. Healthy diets are out of reach, as Ana said, for around 3 billion people, and the world is not on track to achieve global nutrition targets. This comes from the State of Food Insecurity and Nutrition in the World done by several UN agencies. So just to add on to what Ana presented already, if you see from these trends estimates, there are the little targets in red. Those are the global targets. And as you can see, for low birth weight, for instance, some regions are achieving these targets or below, are really achieving the targets, and some are not. So for low birth weight, the world in general, Africa and Asia are above the targets, while for stunting, several other regions are, as well as the world, if we continue with current trends. For overweight, almost no region would be achieving the targets by 2030. And for wasting, these are not trends because wasting changes constantly, but also most of the regions would be above the targets for 2030. For exclusive breastfeeding, we're doing a bit better, but still, if the current trends continue, we would not achieve the trends at 2030. For anemia, definitely not. And for obesity is also unlikely. So what was the impact of COVID-19 on the pandemic? And Ana presented some data. These are other data also, depending on how you look at it. But as you can see, the trends with the COVID-19 pandemic, if we have the moderate scenario, we look at child stunting, and the data showed that around 5 to 7 million children may be stunted additionally, and between 570,000 to 2.8 million more wasted in low-income and middle-income countries by the year 2030. And the cumulative estimate of additional cases of wasting from 2020 to 2030 would be between 16 and 40 million. Again, all of these different forms of malnutrition also have an effect of NCDs, and the projections from the International Diabetes Federation estimate that by 2045, about 629 million people worldwide could develop diabetes, and the largest increases could be in Africa, the Middle East, North Africa, and Southeast Asia, which would already stress health systems in places where capacities are already strained and resources are scarce. We already saw this morning that dietary risk, and also from the previous presenter, that dietary risks are high depending on how we look at them in risk factors for disease. So I will not stop there, but I will follow up on the sustainability as the other major challenge in the 21st century. So what do we know about climate and food consumption and production? These very recent estimate from our World in Data show that about worldwide, about 1/3 of greenhouse gas emissions come from food and food systems. These vary between the largest chunk come from land use and agricultural production, and then the rest of things, food processing, transport, packaging, and retail, as well as consumer preparation, make about another 20%. And then end-of-life waste does about 8.6%. When we look at individual foods, we looked at, for instance, in the European Union, and this is highly contextual, as we saw just recently, is that dairy and meat and eggs, depending on production and how production is done, can constitute up to 83% of emissions, dairy, meat, and eggs. And then the rest of the foods do the rest of the contribution. And this comes from different processes that happen in the food production, the use of synthetic nitrogen fertilizer, or contributes about 40%, but most of it is on land use change, that is deforestation, for instance, methane from cattle, and manure management. So those are the highest in the European Union, as I said, and this, of course, is highly contextual. And just to talk about more of context, depending on the income is highly correlated with greenhouse gas emissions for average diets. So, for instance, in a lower middle income country, normally we would see about 1.1 kilograms of CO2 equivalent per person per day, while an upper middle income country could, the average would be 1.6 CO2 equivalents per person per day, and high income countries 2.4 kilograms. But there are some outliers, such as Brazil and Australia, that have emissions over 200 higher than average of their respective income groups. The United States, Canada, and Norway have emissions about 40% higher than the average for in their income group.
Anna, we have gone over our time. I'm sorry. We need to do the next session. Okay.
Well, just to end, what we see that diets and climate are two major challenges, and what we propose at FAO is that we need to have diets be healthy and sustainable. So I invite you to look at this publication that WHO and FAO put together, the Sustainable Healthy Diets Guiding Principles, that provide a description of what are sustainable healthy diets, their aims, and 16 principles for sustainable healthy diets. How do we propose that we can promote them? by developing and revising and implementing, which is critical, national food-based dietary guidelines to inform policies and programs all along food systems. And so we propose that countries develop, revise these guidelines by doing a multidisciplinary process with multiple sectors to include ownership, taking care of conflicts of interest, integrating sustainability, and implement them widely, effectively in collaboration and with partnerships to create enabling policy environments, policy coherence. You can also, through FPDGs, do food systems analysis for healthy diets, quantify and balance trade-offs, and have a baseline for effective monitoring and evaluation, and again, promote the practice of sustainable healthy diets, also through capacity development. We are currently engaged in a revision of how to develop and revise and implement food-based dietary guidelines since 2018 to increase their effectiveness, and finalizing a methodology to develop and revise food system-based dietary guidelines, to developing a menu of indicators to be used for each of the sustainable healthy diet guiding principles, and a methodology for developing nutrition guidelines and standards for school meals. Thank you so much. For further information, please contact us. Thanks.
Thank you so much, Anna. I'm sorry I put you under great stress. And I do want to apologize to Prakash and IUFoST for eating into your time. We are very good friends, and I know you don't mind. And Anna, and you have been very good. But this session has told us about Africa that is rich in diversity, but certainly we have not exploited what we have as our natural resources. And Nakajima did a lot of insight, gave us a lot of insight, and Anna has thrown light. And I shudder to think and wonder whether we'll be able to meet the goal set for 2030. It's a big challenge. I could go on and on, but I would want to stop here and hand over to Prakash and his team. Anne, over to you. Thank you so much, Anna. Anne.
Thank you, and it's a wonderful time that we had with the two sessions, and perhaps it's a good time that we now move on to the next session of IUFoST, which is actually the session 4 of today. This has the title of Innovations in Food Science and Technology and Sustainable Food Processing. And you heard that from Aman and Feridun, the previous one. The connected one in the Innovations in Food Science and Technology is the relationships that build in and the collaboration with other sciences that is so dear to ISC, basically. So this one is going to be highlighted in this session. It is ably chaired by none other than Christina and Sebastiano Porretta. It's my duty to quickly introduce them in a couple of lines. Christina, who is an assistant director at the international division at the Portuguese Catholic University and chairs the working group of IUFoST and education. And we also have with us Sebastiano Porretta, who is the senior researcher at the Italian Ministry of Environment and Development at Parma. We all heard of Parma cheese, right? Italy. And also, he is the president of the Italian Association of Food Technology. I would like to say for over 2 decades. And that's not easy for a president to survive that long. Wonderful, wonderful. So over to you, Christina and Sebastiano, to conduct this session entitled Innovations of Food Science and Technology Sector in Relationships and Collaboration with Other Sciences. Christina and Sebastian.
Thank you very much, Professor Prakash, for the nice introduction. It is now my pleasure to introduce Professor Sam Sagui. He is Professor Emeritus in Food Innovation and Technology at the Hebrew University of Jerusalem in Israel. His main research topics focus on open innovation, new products development, consumer research, modeling kinetics, shelf-life optimization, rehydration, frying, and wetting. He has a broad academic and industrial experience including several companies. He also serves on several editorial scientific boards, and he got an enormous number of awards. And first of all, he is a good friend of me. The topic of his presentation today is Future of Food Science. Thank you very much, Professor Sam.
Good morning, Christina. Good morning, everyone. I'm talking to you normally from Tel Aviv, Israel, but today I'm in the US at Amherst, sharing with Professor Peleg. And before I start, I'd like to not forget to thank all the people that made this presentation possible, and especially to thank Judith Mitch and also the chair of this session, Christina and Sebastiano, and also definitely my co-speakers, Ferru and Boeing. It is a real pleasure to be here today, and let me share with you my presentation. Okay, let me see. To start at the beginning, I don't know where I am. What's happening here? Okay. What's wrong here? Sorry for that. Let me see. Okay, that's where we start. What I'm going to do today in the short time that I have, I'm going to be very brief on a short introduction, then starting to talk a little bit about the enabling technologies and challenges. Following that, I'm going to focus on some paradigm shifts that I think are necessary for the future. Talk a little bit about take-home messages and add with a personal note. Before I start, let me go to the introduction and present to you a person that most of you, I assume you don't recognize or heard of. His name is Joseph Schumpeter. He's an Austrian, born in Austria. He is a very well-known economist, and since 1932 was a professor at Harvard University. Now, his theory is very interesting, and what he says really that actually when you're starting a new innovation or anything that is new, it comes with a price. And his, and I've summarized that, process of industrial mutation that continuously revolutionize the economic structure from within, incessantly destroying old one, incessantly creating a new one, which means that there is a price for the innovation that we see today. And if we don't recognize that, then the price is going to be quite high. Now, although his theory was published in about in 1940, 45 or something like that, his theory now comes to take effect, and there are many books that were published only recently, a year or 2 years ago, that are focusing on this theory. So what we should expect, and we as a profession as well, we should expect that this is a dramatic time. It's a shift in business. Business is not as usual, and working forces and education should take a close look at that and try to understand what are the opportunities and the threats. And unless we take some action, the threats are going to be very significant. Now, let me share with you just a very small indication of that and what that means. If you're looking on this figure, you see that the average or the median age of an S&P top 10 company, S&P, those who are not familiar with, is an index of the industrial most influential companies in the world on the stock exchange. And you can see that the median age for the company was 85 years in 2000. If we're moving to 18 years later, 2018, the median age is already 33 years. And prediction into the future, not too far away, to 2027, the median age is going to be 12. So what we see here, that more and more companies are leaving and more companies are coming in. So that means that the price that innovation takes is very, very huge. Now, the unicorn, the startup that reaches $1 billion revenues is now 6 years. And the valuation here is really very high. It's 8.7. So more and more money is funneled into startups and in these directions. We're looking on this graph, and this is the amount of money spent on startups and new companies. You can see that there is a flow of money into this direction. And actually the number of activities, you can see here, it's about 409, and the amount of money spent in 2020 was 23.6, almost billion. In 2021, in the 6 months already, we spent or we diverted that amount of money that increases that. So actually what we are seeing is that more and more money, in spite of the pandemic, is going into the innovation, and this is taking an impact and is going to affect what we are doing in this domain. A recent publication that was published recently by ARK, which is a very distinguished company, showed that actually there are 5 major blocks or major platforms of technology. The first one is the blockchain, and I'll expand a little bit about that more. The biggest one is the artificial intelligence right here, then the DNA sequencing, energy storage, and robotics. If I give you an example now about artificial intelligence, and I'm looking on the graph on the right, then you can see that most of the activities in this area, the average growth rate, compounded growth rate, is anywhere between 10% to 35%. Normally a business, a food business, the average compounded growth rate is about 3%. So you see the incredible impact of this, the artificial intelligence is going to have in the future. Now, if we're looking on the revenues, it's very clear to see that the amount of revenue, the predicted amount is going to be mind-boggling, and it's going to reach almost 500 billion in the next couple of years. What we're talking about? We're talking about virtual reality, we're talking about augmented reality, and now we're starting to think about also mixed reality, and all of that is summarized in what is known today, metaverse. And metaverse right now, if you're following what's happening on with Facebook, they advertise that they are going into a metaverse. If you're not familiar with this, this term, what it means is that actually we're going to have a real world and an artificial world, and the both of them are going to be existing at the same time. So think about that you're sitting at home and you're doing whatever you like to do, and your image, avatar, is going to go to work and do the work for you. This is what actually it means. And there is more and more work in this direction. But think about the opportunities that that is going to provide us in our teaching, in our studying, in the way we communicate with students, with consumers, and many other things. So this is here to stay and is going to affect every aspect of what we are doing today in the future. Another figure that I wanted to share with you is the Internet of Things. And when you see on this graph, you see the amount of units that are going to be available and in the future. So if we're jumping less than 10 years into the future, we're going to see more than 50 billion units that are going to combine and make the whole global connectivity and not an issue, but an opportunity, a reality. So we have to understand that everything is going to be connected. And I can ask you one question, you know, what your university is doing in this direction, how food science and nutrition is going to be interacting with that, and we'll talk about that a little bit later. So what are these devices? These devices are going to connect all the devices that we have that cost probably $5 to $10 and above, and it's going to start from the industry, going all the way to the kitchen, to the appliances, to our phones, and all of that. And everything is going to be connected. What that means that this is an area that we should not forget, or we should not ignore. And actually the prediction is that it's going to grow 20 times, and it's going to be almost 50% of the US GDP, which is unbelievable and unheard of. Now, the amount of money, the amount of data that's going to be created is going to be mind-boggling. And we're talking about zettabyte, and I'm sure most of you are not familiar with that or not really know exactly what it means. So you should look on the figure, and the figure shows the increase in the data that we are going to produce in the future. And if you're looking for what a zettabyte is, it means that it's 10 to the power of 21 bytes or trillion gigabyte. When you think about that, that most of our computer today is a terabyte or 1,000 gigabyte, you see how many or what is the quantity of data that is generated. So big data is a real an image, or it is a quantity that we have to consider. Now think about again about your program and question yourself, is this something that you are doing in your university? And if not, why not? And if yes, okay, what, where, and how? Now let me take a picture of 1 minute of what's happening on the internet. And this is a slide that shows what's happening there. We can talk about this figure for the whole day, but I want to focus on 2 items only, and forgive me not to explain all of that. But let me focus first on the number of transactions online. And you know, because of the pandemic, we have more and more people going online. So you can see here that every minute, $1.6 million are spent online. This is just coming, and we're going to see more and more increase in this number. The other thing that I wanted to share with you is what's happening on YouTube. And when you look on this figure, it shows that 500 hours of content is uploaded every minute. So we as an organization, IUFoST, IFT, whoever you are, have to realize that whatever you put on the YouTube or any other media, there is an incredible competition. 500 hours of content is uploaded every minute. So in order to reach our audience, our media, and to share our knowledge, our ideas, and so on, you really have to be very effective. You can do that if you have only professional people to help you out and make it really an impactful presentation and impactful content that people are going to look at that and try to make it viral. So this is a very important thing to remember. Now, in other words, we are facing an incredible increase in change in rate and change, and we moving from the past that was linear, we're moving into the present that is exponential, and in the future, it's more than that, it's an acceleration of the acceleration. And I'll explain in a second what that means. We are talking today about, and we explained that or described it as VUCA, volatility, uncertainty, complexity, and ambiguity in the environment. And we are saying people believe that the changes in the amount of information that happened in the last decade between 1920 to 2020, 100 years, is going to be included or summarized or doubled in 10 years now between 2020 and 2030. So what we see here, we see the time collapse of acceleration. And the expression is templosion, is where time is decreasing to itself and things are happening in an accelerated and an incredible speed. So the exponential change is exponential opportunities, but still there are very many threats that we have to consider. I'm looking at this graph, and this graph shows what is known as Moore law. I don't know if you are familiar with that, but Moore was very high up in the chip production in Intel. And he said that the price of the computer or their capacity or their power is doubling every 2 years or 18 months. If we're looking on the cost of genome, you can see this graph, and the green graph here shows what happened to the cost of genome, of human genome expression. It started with 100 million only in 2001, and in 20 years it went down to almost $400 or $500. So there is a decrease here of 100,000 in 20 years. Now, if you look on this is exponential line, but you see here that there is an acceleration of the acceleration. Now, what that means in exponential time? If I tell you that I am 30 steps away from my refrigerator at home, then you think, wow, he has such a mansion, a huge house. But if I'm an average guy, and I am an average guy, and my step is 1 meter, so I am about 30 meters from my refrigerator. But if I tell you that I'm taking 30 steps to my refrigerator, and it's an exponential growth or change, then in 30 steps, I am going twice around the globe, because it's 1, 2, 4, 8, 16, 32, 64, 128, and so on. That is the meaning of the exponential growth. So actually, the knowledge is doubling almost every 2 years, and we have to realize that this is what's happening today. And the only way to compete with that or to comply with that is that we need to partner and we have to share. So in order to understand that, what we are saying is that change is the law of life, and those who look only to the past or present are certainly, to me, is the future. This is John Kennedy said, and the one that I really like very much because he's the father of management. If you want to predict the future, create it. This is the only way we can do something about the future, that we need to create it. So what we are going to do, and I'm looking on the gap analysis, and when I'm looking on gap analysis, I like to do and understand what we need, what is needed to be done. So in order to do that, we have to answer 3 questions. Where we are now, where we wish we were, and how we are going to close the gaps. And the only way we can do that is that, and the motivation is that we need to change. Who is going to do that? It's we. We cannot rely on anybody else. And when? It's yesterday. If you don't agree with yesterday, okay, so today. And what I'm suggesting is 3 steps. The first one is leadership. And the leadership is very clear. You need a vision, you need a strategy, you need a map, and you need a compass. So you need to know where you're going. And this is what the role of management to do, is to show us where we should go. This is a definition that I like very much, that leadership is a visionary, seeing the invisible and believing the unbelievable. This is what we need from our management to show us the direction, and we have to unify on something that we agree on together. We have to create this space that we can work together, and let's not forget, we need also passion, because we have a wonderful profession and we need a passion to unify and work together and collaborate. A few years ago, there was a book that was published by Ismail and his co-authors, and he developed the massive transformational purpose, MTP, and he looked at and he found out that there are 3 questions that really typifies these companies. One is, why does organization exist? How will our organization solve the problem? And thirdly, what will be our global impact? If you're looking at Netflix, that's what they did to change the way people watch movies and television. If I look at the IUFoST, my suggestion is becoming the global knowledge and education ecosystem for producing safe, it's not safe, it's safe, personalized, nutritional, healthy, and sustainable foods. So the second step that I'm suggesting is a paradigm shift and change. First one is open and disruptive innovation and a new mindset. Open innovation means that actually when you're looking on the developing of a product, the information can come from academia, AC, large company, small, medium enterprises at the beginning of the process, during the process, and then you can produce one product or have other products that you can come or share the product with others. So open innovation means not all the bright people and the smartest people working with you. This is why you have to collaborate. And when you have ideas, they can come from outside, not only from inside. So actually what it also means that we have to embrace open innovation and new mindset, that we need to open up not only our profession and our skills, we need to rely on others. So that means entrepreneurship and employability for our students, and also a term that is developed in Japan, and that was Kaizen. Kaizen is making small improvement one after the other. This is not enough today. We need to think about disruptive innovation, innovation that are going much, much faster than one step after the other. The second paradigm shift is a 4-helix partnership and ecosystem. And let me give you an example. This is a picture taken from a desert between Los Angeles and Las Vegas. It's called the Valley of Death. And when you look at that, and this is a cartoon that you see on one side, you see the academia, on the other side, you see the industry, those that are trying to cross this shaky bridge, most of the time ending up here. So actually, when I look on all the key players in this process, you have the government and the private sector. So you need open innovation to provide the platform and the bridge to integrate all of them. So the 4-helix is the government, academia, sector. This is what I call the innovation ecosystem. And now I'm come to our profession and our discussion today. You have food science and technology and then included engineering. On the other hand, you have nutrition, and you have genomics, which is the processing that relate not only to the host, but also to the microbiome, and consumers on the other side. And again, you have health and wellness that are combining all of them. So it's not one individual. One cannot do that unless you have this integration. And this 4-helix the innovation ecosystem, I don't believe we can be able to do that. The third one is the big data, information, integration, and personalization. And all of us agree that the future is personalized. This is a figure that I took from Professor Gibney, that provided that in a presentation to the IUFoST in 2016 in Dublin. And he showed very clearly and brilliantly who are the people or who are the forces that are combined in personalized nutrition. But I'm sorry to tell you that he didn't show, I don't know why, he didn't show that there are key players that are missing. The first one is on the left, it's food science and technology and engineering to produce the product. The second one is the consumers. You cannot force products to the consumer unless they like it. And when you do that, you need to take into consideration innovation and microbiome. And now we should also talk about sustainability and food life cycle assessment. Let me share with you 1 minute of a video. What you see here is the face recognition, and then the personalized product created by a robot. (3D) printing of a computer. Okay, what we saw is really an introduction to the future, and I hope this is something that all of us can think. It's not that far away into the future. Actually, it exists today. 3D printing is available. Now, we talked about sustainability, and I like to share with you a publication that was done only recently this year by Professor Oliver Juliet, and he looked on food life cycle assessment, and what he did is very interesting. What he did is very interesting. He looked on the function that every food contributes to life. So every food he was able to translate in the number of minutes that a person is gaining or losing. So he developed what is known now as a new life loss function, that he could calculate the time gain or the time lost, something similar to Taguchi quality function. So by doing that, actually, he could combine that also with sustainability and nutritional assessment. So now we are capable of not only finding out what the value of the product is in terms of the contribution to life, but also its sustainability and nutritional assessment as well. So his conclusion, and it's very interesting, is saying that small targeted realistic changes generate substantial gains for human health and the environment. There are similar approaches by Dr. Heribert Watzke that looks on Google mapping of foods and several others. So actually, we are at the point that we have a lot of data, we have digital capabilities, we have cloud computing, and we have so many other application capabilities that we can apply, and this is just a question of time. So the first one is looking on education, and this is really very important, because nowadays we have to realize that, and this is a report by the World Economic Forum that says that 65% of the children entering primary school today will ultimately end up working in completely new type of jobs that don't yet exist. This is really something to take into consideration, because we don't really know what the future is, but we can start planning for it. I'm not going to talk about, because I'm running out of time, but the students today are different. They are different generation, and we have to think about completely different in terms of providing them whenever, wherever access to learning. And finally, the educators should be also different, because we need to change our ways to do that more personalized, and you need new criteria for doing that. So education of the future is really looking into ways of partnership, and not only among ourselves, but with other disciplines and so on. If you're looking on the world, this is already happening, and I'm just going faster over that because I'm sure you know that. But the only thing that I can say here is that the opportunities are providing a lot of threat, and changes are requiring, so we can do that a much better job in the future by preparing for that. The final step that I'm recommending is the adaptability, and actually what that means is that in the future we need to be more adaptable, and we have to teach our students how to be more adaptable in order to tolerate not only success but also failure. Okay, so what are the take-home messages? They are very simple. First one, this is a complex time. It's new normal. Sustainability, health and wellness are a part of that. Significant exponential changes and opportunities, challenges and threats are here, and we have to deal with them. Innovation and digital transformation mandate an ecosystem of multidisciplinary collaboration, partnership, and risk-taking. Leadership, we talked about that. We need to integrate nutrition and food science and technology and engineering. And finally, we need some paradigm shifts in education in order to take into consideration what is happening in the digital world. And finally, obviously, IUFoST has to adopt an MTP, and this is my suggestion. I'd like to leave you with this personal note, is that if you look on what's happening in our domain, we have to look on the core, that this is the trunk of the tree, and then we have to add all these leaves that are the tree that we are going to grow. Let me leave you only with a personal note, and I'm quoting here a Nobel laureate in literature. This is an example how to collaborate between engineering and literature. And what Anatole France said, to accomplish great things, we must not only act, but also dream, not only plan, but also believe. And my question to you is, what is your professional dream? How will you contribute to shape the future? And my third step is action. If you like to hear about that, you have to invite me once more, and we can discuss that as well. So thank you very much for your listening, and I'll be very happy to address the question later on. Thank you.
Thank you very much, Sam. Thank you very much of your nice, warm, and full of data lecture. We share the pleasure to collaborate with probably the greatest expert on consumer science. I'm talking about our Moscowitz, of course.
Absolutely.
The common friends, yes. Just listening to your lecture, if you please give me the address of my avatar, which will work for me, I will appreciate, since I haven't found him yet. Okay, Thank you very much. It's now the turn to Dr. Feryu Erdogdu of Computational Food Processing Group of University of Ankara, Turkey. Is here, okay. I looked at the personal website yesterday, and I invite you to do the same. It's quite interesting. There are many papers published. The production is very full. And as a professor, a visiting professor, almost everywhere, I see Italy, I see Sweden, UK, Germany, and California. Congratulations, Dr. Erdogdu. The title of its lecture is Engineering the Food Science. Please welcome Dr. Erdogdu.
Okay. Thank you very much for your nice introduction. And I would like also to thank everybody for today, organization, and also for the invitation. And I also to thank my co-presenters, Sam and also Aziz. I'm hoping that my slides are visible right now. I will just give me a second. I will start this one.
It's better if you put in the whole screen.
Yeah, I will do that. Yeah, just give me a second. Just a second. Okay, I think we are ready. Yeah, thank you again for the introduction. And I kind of summarized my topic today for like future engineering and food science and technology. As just was mentioned, I am from Ankara University, Turkey. We say that this is the first university of the Republic. The contents of my talk today are gonna be divided into several groups. First, I will talk about the world, the way we have been, or where we are going. And then I will share some slides about the engineering and of course the situation of the food engineering under the umbrella of food science and technology. And then I will talk about the industry and food industry with the requirements of today and of the future, and probably these will give us the answers to where we are going. So if we consider and if we look at the world right now, we are talking about the globalization for several decades now. And with respect to the Thomas Friedman, as he explained in his book, The World is Flat, we are talking about the flattening. So the world was a quite large place until the end of 1400s. So basically when Columbus set sail and when he combined the old world to the new world, so it became from large scale to medium scale. So the 300 years was for this purpose actually. After 1800s, it became rather small with the force of the dynamic forces, and those are about all the multinational companies that we have seen. And after 2000, that when the globalization term was introduced into our dictionaries, and with the introduction of the late 1990s World Wide Web, and we started talking about from small to flattening. And as we all observed and we lived through it, and we have been still living through in 2020, we had to change of some of the old habits. Maybe one more time, considering that we made a significant change with the introduction of internet or World Wide Web. So that is the world right now we have been living in. So in this world, if we look at the engineering, Freeman Dyson describes engineering with the concept of design. And with your permission, I would like to add the prediction to this term or the concept of design. And this equation you observe in my slide here, the integration of tangent square x, is the perfect definition in my dictionary for like design and prediction. So basically, if you want to solve this integral, if you want to take this integral mathematically, there is only one way. And for that, you have to know the derivative of tangent function. Without that, you cannot solve this problem. So that means that for prediction or for design and prediction, we have to have a certain background. So without a background, we cannot do that. And if we look at the food engineering now, we are not definitely not under the or one of the major or significant engineering groups like mechanical, electrical, or chemical engineering, but we can under the umbrella of or with the intercircle with the food science and technology, we can define ourselves and evolve discipline. And we require the combination of all the other engineering background into the principles of food science and technology for design and prediction, or for design and optimization, or processing or manufacturing system. So that's all we need. So just as an evolved discipline, if we consider the microwave system or refrigerator in our kitchen, somebody can consider this is the production of the principles of mechanical engineering or electrical engineering. But we should not forget that all these are designed for food. So that's why we have to include, or we have to bring out the concept of food into this design. And for this reason, if I may say here, a couple of my students build up a new company to design these kind of systems, but their first point or first focus is food rather than the process. So their design or our design is now starting by considering the food product itself directly. So based on these examples, we can say that we are still evolving. And if you just have a look at the last 70 years of food studies, for example, in the Journal of Food Science or Journal of Food Engineering, you can see that easily we have been moving from chemistry-oriented studies to physical chemical properties and microbiology. And the recent focus or recent concept, including myself and my group, is process design and manufacturing systems with scale-up issues. And we are even in the now molecular biology and nanoscale science. So we as a food science and technology group, we are like everywhere in the engineering and science groups. So that's the reason that I'm saying that we are still evolving, and we will continue to evolve. So that's why we can say that future of the engineering will be more demanding. And with this more demanding, now we have like three aspects of this concept. So on one side, we have the requirement of engineering fundamentals. On the other side, we have the requirement of analytical problem solving. And on the third side, we need the interdisciplinary collaboration for the control and use of data. So these three things are already cut into each other for more to demand the future of the engineering, including the food engineering or food science and technology. So that is the situation of engineering and food engineering right now. And now industry, so basically starting from late 1700s, since we are talking about industry 5.0 right now, so industry 1.0 started with the invention of steam engine. And it was like, with that, we observed the first industrial systems in the process lines. So it took us, the humanity, for like 100 years to move to the industry 2.0 due to the electricity and oil. So with that way, we achieved the mechanization and mass production. So then another 100 years for industry 3.0, where the informational technologies and electronics were brought into the picture. But then it was rather short to move into industry 4.0 with digitalization. And when we are talking about industry 5.0, we are not saying that industry 4.0 was completed, but these two sections now are basically two circles touching internally. Because now we are combining these two parts with like artificial intelligence, robots, or virtualization, or all the other possibilities. So when we are moving from Industry 4.0 to 5.0, now we brought up the issue or requirements of Internet of Things, artificial intelligence, and virtualization. So these things are combining this section right now for maybe a better industrial process lines, or that is why we are talking about what do we need from our food engineers or from our food science and technologies to cope up with these requirements. So food industry, when the industry is making or getting through this big and significant change, food industry is still, unfortunately, depending upon the conventional and traditional processes, and with a big question mark of the open innovation. And that's like, since I have been involved with the food industry for several, like 2 decades now, open innovation is a big question mark, since we are consisting of complex global and network of businesses, small enterprises. And we are like in the production, distribution, processing, packaging, transport, almost everywhere. And to open up the innovation for all these different sections or different parts is like a big question mark right now. And the best, if we just look at the manufacturing and as an umbrella, computational food processing now should be or is within the direction of industrial revolution. So that is how I will show to combine all those requirements of like artificial intelligence or the digital things with the processing or manufacturing. So just a small reminder to all the attendees, the food industry, even though the food industry achieved a significant advances since the beginning of history, like canning was like the startup of the processing line, food processing. So, but for 200 years, it started with the vision of Napoleon Bonaparte, and for 200 years now, we are still having almost the same process without major innovation. So I am actually, my group introduced one of these innovations, the use of toroidal cans almost 10 years ago now, and we are still trying to get attention from the industry, and which we are not having much. So that's why we are still I am having this question mark next to the open innovation, especially in the view of the food industry. Considering that we are at the verge of moving food processing to Industry 5.0, as I just indicated with digital technologies and virtualization, now we need a very radical change for the very rather specialized knowledge. So food industry, while it is high, it has the highest rank in manufacturing. As I just indicated, it has still the quite low rank in the innovation. So that's why we are questioning the readiness of the industry to the Industry 5.0 and the use of all the digital technologies and virtualization tools. So basically, these requirements like in-depth knowledge of engineering and math, and in-depth knowledge of food chemistry and microbiology combined with the engineering principles are opening up or are giving us the availability for open innovation. And if we can do that, if we can take care of that part with the use of virtualization or computer-aided approaches, with the use of digital twins, artificial intelligence, and Internet of Things, or with the use of big data, we can incorporate the development of the engineering into the food science. So that is like kind of the requirements, and that's the big things that we need to achieve, because in the future of food engineering lies in with the view of process innovation. There are just several things that we are talking about now. The first is like digital twin concept, virtualization, artificial intelligence, and Internet of Things. And all these are apparently for sustainability and dynamic analysis. And of course, we should not forget the robotic tree, or now we talk about the four-dimensional printing cases. So all these are the future of the engineering, and that's why I'm saying that we need these requirements for incorporating all these developments into our food science. For all of these things, as just Sam also mentioned, that to take care of or to look into the zettabyte of data, we need to like strong and big computers. So if you just look at the computers in 50 years, that's where the left-hand side is like 50 years ago, and the right-hand side is now. And I am from a generation, it is now maybe too bad to say, but I had the chance to use the one in the middle. That was the first computer with a hard drive, and its hard disk was 20 megabytes. So now the one I am using right now is one of those on the right-hand side. And now all these will not be enough, and the quantum computing is coming up, and this zettabyte data is basically will be handled with these quantum computers. And imagine that one of the most powerful computers, what the most powerful computer can do right now, calculation-wise or computation-wise, in 10,000 years, this quantum computer will do that in less than 4 minutes. So that's with those tools in the near future that we will be able to effectively use the digital twins and virtualization abilities for the food processing or food manufacturing, or even control the whole process, everything from harvest to work. So that's how we will be able to manage. So digital twin and virtualization are the major things right now that everybody, I mean, the science are into this and talking about this. So this is all about the incorporating the modeling into actual process and simulation or virtualization in a smart way. This is all about digital twin is about in a short, definition. So that with that, the online incorporation to use this big data and enable the required changes and make corrective actions during operation for an optimized process, that's what we will be accomplishing the use of digital twins. It should be the part of the process, part of the operation, or the whole process, or the whole operation. So imagining that we have a system with controlled by this artificial intelligence and digital twins, that first we are sorting the ingredients or raw material with respect to composition, making the significant analysis like by using the hyperspectral imaging or all different image analysis tools, and we are calculating quickly the composition, geometrical features, whatever we need to predict the process. Then quickly we are determining the process outcomes for the process optimization, reshaping the process parameters, feedback to the process line, and there with the artificial intelligence abilities enable the process optimization with a very rapid decision making. And that will be like an improved process. Like if you look at this small picture here, so we have the data produced from our physical twin, and this data is being fed to our digital twin part, and by virtualization and artificial intelligence abilities, we are checking the data, controlling the data, making the required calculations, and then feedback the new process parameters to the physical process to improve the actions or for process control and optimization. So there, with this quick way, we have a safe, improved quality with a high profit. So that is just the summary of how like artificial intelligence and virtualization with the digital twin concept might work. So I just want to have a small movie that we generated. So imagine that we have a bakery that it starts with the raw product, flour, water, and salt. So here, this is the logo of my group, CFP. So imagine that we are controlling this with our computational abilities, whatever is happening or whatever is in the process line. So we are checking the composition of our flour, and now based with respect to that, we are calculating the time that we will spend in the fermenter. And then we are calculating the required pressure in the dough rounding part. We are even calculating the required mixing parameters for a better aeration of our dough. And then we are forming the pre-calculated pressure affects the formation, and the time temperature is already fed into this process, how much we will be able to bake our product. So that's, through our computational abilities, artificial intelligence, and that is the data coming from our digital twin part. So there, after that, when we have the product, we will have slice and we will have like the package it. So this process line will have its twin in the cloud, for example, and all the parameters will be fed there, and the process parameters will be calculated and then feedback again to the process line, and everything will be digitally optimized and digitally controlled to make the changes and get the perfect product. So this is kind of what I have in my mind for the near future in the use of digital twin concept and virtualization. So basically, I can say that like our dream is to have a process with all the variables will be under control. And for this purpose, we will need a solid state background for this digitalization and integration of engineering with food engineering or food science and technology. So with that slide, I would like to complete my talk by thanking all of you for attending with the smiling face of virtualization. And I will be happy to answer the questions later on. Thank you very much again for everybody.
Thank you, Professor Freire, for the excellent presentation and for keeping the time. In your conclusion, it's in fact one of my biggest concerns is how to find or prepare these professionals with all this knowledge and skills, something that we can maybe discuss later.
Thank you.
The third presenter is Dr. Hing Hazisboing Sitangang. He is a faculty member at the Department of Food Science and Technology and coordinator of Food Safety and Quality Program of the Southeast Asian Food and Agricultural Science and Technology Center in Bogor University, Indonesia. His research includes membrane technology for simple and complex enzymatic reactions, reactor designs, and related topics in food processing and engineering. He is a member of the early career scientist section of IUFoST, and he is also a member of the working group 1.2 on education of IUFoST. So today he's going to give a presentation on the future opportunities of young food scientists. Dr. Boying, the floor is yours.
All right, thank you very much, Christina, for your very nice introduction. So I would like to also thank my co-presenters, Sam and also Freire, very nice presentations indeed. And I would like to also thank all the organizing committees who's inviting me to present in this very attractive and also substantial event. So let me share my presentation in here. You know, when you are the last presenter in the row, so it's kind of like a burden to you how to keep up all the audience, okay, still going on, still following up the discussions within the event. So I would like to talk about the future opportunities for young food scientists. I'm gonna give another additional title in here, perspective, because I'm going to tell you about what are the future opportunities for young food scientists from my perspective, because I'm actually early career scientist at IUFoST, and also I'm a lecturer at the Department of Food Science and Technology, IPB University, Indonesia. So let me start my presentation with by reading these two sentences in here. It reads as follows. The young scholars of today will be the pool from which the scientific leaders of tomorrow emerge. And the science system of the future in any country can only be as strong as its pool of young talent today. So simply speaking, I would like to say that nurturing and producing well-equipped young scientists is a substantial asset for the development and sustainability of science for any country in the future. So we have to agree first that young scientists is a substantial asset in the future for any country can have. So let's start with the definition of young scientists in here. So quoting from the Global State of Young Scientists Project report, young scientists can be defined as a postgraduate or early career researcher of any disciplines actively pursuing a research career. So we have to quote in here, research career, usually without being fully established yet. Normally, we can say young scientists around 30 to 40 years old, a doctoral student probably, or a university teacher without doctoral degree, or a person who has had a doctoral degree for a period not exceeding than 10 years. So by looking at the definition of young scientists, then we move forward. What do young scientists today have in the future? So I'm going to quote from editorial from Nature. Young scientists nowadays are in trouble, or so it seems. Why he or she says like that? Because young scientists at the moment face a harsher, more competitive, stricter, more dispiriting workplace than their bosses or even senior colleagues did at the same stages of their own careers. Things are simply not the same as they were back in the day. They are more difficult. So this is the problem that we are facing right now, especially like me, like a similar person like me, that are considered as whom are considered as young scientists. So what are the problems of young scientists? In here, I can actually give to you some sort of early stage professional issues, especially for young scientists, like the learning professional skills. We have to learn about budgeting, grant writing, managing personnel if we start to do the research. And then, of course, with unavoidable responsibilities or delegation coming from our seniors, do not have support staffs as the senior have, okay? And we see nowadays, there are no stable job prospects, okay? No stable job prospects, okay? And also, of course, because young scientists almost at the stage of marriage, so we've got family issues as well. We've got young children, spouses having different professional obligations. And then with societal challenges in the era of this VUCA, volatility, uncertainty, complexity, or even ambiguity, we don't have much time, or we have less time than others to do research or to ponder big ideas of how to conduct research. So in terms of academic assessment, probably we will end up with lower productivity or lower degree of key performance indicators with all these things happening in front of us. So that's general issues with young scientists. So let's have a look about foods of the future. I believe that Sam already presented nicely everything, what will come in the future regarding the foods and food science education. So have a look here. The start of modern food processing actually began with the invention of Nicholas Appert. Okay, if we see, Nicholas Appert invented such technology where the food was packed hermetically in a glass container, cooked in a boiling water to destroy bacteria, no preservatives added, had a long shelf life without refrigeration. And up to date, I think the technology or what's so-called thermal process is widely adopted in food industries. And after this, we see the enhancement or the advancement of the food industries. Okay, until 1990, and then even up to date, we've got so many food industries providing for us food and beverages, ready to eat, ready to consume foods and beverages. We've got so many options. Although we see some issues regarding this ultra processed food, but once again, we do agree that it's not about processing; it's more to the components of the foods that are actually containing. So, quoting from science, foods of the future might be something that has to be healthy. That's the first thing. And the second has to be safe. And then probably it will be more personalized, like Sam already introduced previously. And then if we see the challenges on food processing, it seems like sea waves across the time. We talk about safety at the initial introduction of food industry. We talk about preservation afterwards. We talk about nutrition, sensorial, and things like that. But you know, as a sea wave, a new problem arises once we apparently solve the previous one. I said in here apparently, because you know, when we think about the wave, apparently means in fact, the problems are never totally solved, but keep surviving as a revised challenge. We can prove it up to date because nowadays we still talk about safety. We still talk about how to introduce preservation technologies suitable for certain food products. We still talk about nutrition. We talk about food security. We talk about nutrition security, especially in the certain area or even in the underdeveloped countries. So these are the problems that we are facing for the foods in the future. So now let's move on to the young food scientists. I'm going to quote young food scientists, kind of like food science leaders of tomorrow. So when we talk about leaders of tomorrow, we have to respond to the societal challenges of food science and sea wave behavior of food processing challenges I've shown you previously. So schematically, I'm going to show you this curve that I made by myself in here. Okay, so we talk about young food scientists. So after we graduate from our PhD degree or PhD program, so we probably have an elevation in our career level in here. But after that, in front of us, we've got obstacles. There are two options that we may take. We may serve upon our obstacles, or we suffer due to our obstacles. And the best early career scientists and scholars are better equipped than ever to face the global challenges. So instead of knowing the obstacles in front of us and then just saying, we've got obstacles, we have to come up into idea to answer this title that I'm given. Future opportunities for young food scientists. We need to have mindset leap. Why I said mindset leap? Because instead of seeking, or instead of just seeking the opportunities, okay, but we also creating the opportunities. Young scientists, we have to create opportunities parallel to seeking the opportunities. So this is the mindset leap that I actually offer to all of us young scientists. So when we start young food scientists with seeking and creating opportunities, we need to see, where do we start? Okay, in here, I've shown to you two different lines. Okay, the black one and the blue one. Why do I provide you with two different lines in here? Because, you know, in some region in this world, young scientists probably are relatively complete with knowledge and skills. And in the other part of the world, young scientists probably having incomplete current knowledge and training. So we see knowledge gap across the world. It is more biased actually, especially in the northern area of America and also Europe. Young scientists probably are relatively complete knowledge, are probably having complete knowledge and skills. But for example, in Africa or even in the Southeast Asia, we probably have to see that we probably having incomplete current knowledge and training. And this knowledge gap across the world has to be mitigated. Okay, and to mitigate this knowledge gap, we need to adopt systematic approach, of course. How? We need to see the political will of any nation, national education funding. Okay, they need to provide us with funding. They need to provide us with facilities. They need to provide us with the best teacher. And even if as a faculty member, we need to have training as well. Okay, so training of trainers. We need to have collaborative educations. We need to have joint program between developed and underdeveloped countries so we can have handshake in terms of knowledge and trainings. So after mitigating this knowledge gap, then we are going to face the obstacles together. Okay, especially with this kind of VUCA era, we need to focus on how we can overcome the obstacles together, especially for young food scientists. Well, there are actually two issues, especially for young scientists to face or to overcome the obstacles. The first one, I call it internal obstacle regarding the leadership of young scientists. Okay, it doesn't mean that anyone can publish many papers having a very good leadership. It doesn't always mean like that. We need to learn professional skills. Okay, probably at our PhD degree, okay, we just conduct the research. Okay, research. We don't manage the people. We don't manage the people. Okay, we don't do budgeting. Okay, and things like that. And we also have family issues as well. This is internal obstacles that we have to overcome, or this is the internal issues that we have to overcome. And for the external ones, we don't have stable job prospects. Like Sam already said that probably the employment or the job opportunities for 5 years, 10 years, totally different. Okay, with unaffordable responsibilities given by our seniors, we don't have time. Okay, we don't have time to ponder, to think any big idea. And regarding the scientific assessment being performed upon us, we always think about scientific assessment has to be put on the basis of how many papers being published, how many citations does one paper have. Okay, if we just put it as it is, it means that we are putting young scientists, okay, as a worker where we have to finish the job, the assignment, what is being put in front of us. With these, young scientists will be totally shaped into conservative people rather than ambitious young scientists. So with this kind of situation, I believe that we will have a stagnant, especially for the future young scientists in the next generation. So if we talk about young food scientists seeking and creating opportunities, I'm gonna give you here some options where we can seek a really, really nice, convenience working station or institutional working station, like where we can get mentoring and support structures. This is something that we need to have. This is something that we need to seek in order to serve upon our obstacles. This includes offering advice and guidance, but also structural, for example, like startup grants and programs for young scientists. And the second, focused training. Most of the times, the training given to young scientists is such that is given for the young scientist to work on the assignment being given to him, okay, especially from the boss, typically administrative things. This is not something that can equip young scientists. So we need to have focused training, okay, to make us globally competitive and then participate meaningfully in the society. And the third one, transparency and fairness. Transparency and fairness of the assessment process are prerequisites for diversity and sustainability in science, of course. And then working conditions, how we can mitigate extreme workloads to progress in careers, to give us some time to think about how we can run the research, how we can think about the idea of research, how we can think about how to develop our laboratory. And cultivating values, fair payment, and acceptable workload, and appreciation of new ideas and commitment, family-friendly policies. And this is something that is really nice. We seek for this. I, as a young scientist, seeking for this one. But you know, if we just keep seeking like this one,
please, Aziz, we have to.
Yes, I'm going to be finished.
Thanks very much.
Finished. Okay, if we just keep on seeking without doing or without creating opportunities, I think we are going to end up with suffering by the obstacles. So for creating opportunities, we have to have like a voice to young scientists. We have to give voice to young scientists, like what we have at the moment in IUFoST. We've got early career scientists, promotion of young scientists on a regular basis, like Young Scientist Award, Outstanding Young Researcher Awards, and also, of course, collaborative research networking among young food scientists. I said among young food scientists. How is this collaboration being held? First of all, we have young scientist partner A and B, and then we need to see the needs, creating ideas from the needs, and then establishing working framework. And then based on mutual collaboration, if the quality of young food scientists are almost similar, then we are going to have mutual collaboration. But in fact, it's not always like that. Sometimes we need to conduct collaboration between young scientists where the quality might not be the same. So this is kind of like top-down collaboration. So once we mitigate the gap between young scientist quality, and then these young scientists, especially partner A, will be enhanced, will be equipped, and then finally we will end up with mutual collaborations. And of course, either mutual collaboration or top-down collaboration must be supported by government or institution initiatives, support funding, multidiscipline, or even triple helix involvement. And then this mutual collaboration can be in terms of training and workshop, research visit, joint symposium, or even research forum. And lastly, of course, the outcome of this mutual collaboration would be in terms of academic program like joint degree, joint publication, and pilot project. So to end my presentation, I would like to say, give more opportunities to young scientists, and us as young scientists, we have to also seek and also creating opportunities for us to be excel in the future, especially in the area of food science and technology. by that, I would like to end up my presentation. Thank you very much. Thank you, Sebastiano.
Thank you very much. Thank you very much for your heartfelt lecture. A very interesting, mainly, as I told, heartfelt. But I want to tell you that I totally disagree with you for the definition of young scientist, since I thought I was, or probably not yet. Thank you very much for your lecture. And now
Yes, Sebastiano.
I pass the chairmanship to Prakash for the final discussion. You have the mic off, Prakash.
You're still muted, Prakash.
Sorry, thank you. Thank you, Sebastiano and Christina, for this wonderful session. It's now time for the final discussion. It's a great pleasure to welcome Alfredo with us. Alfredo. And also, I would like Hyun-Suk Kim to join us as a discussant.
All right, may I start?
I need Alfredo. Yeah.
Alfredo, okay, yeah.
So by the time Alfredo joins, perhaps Hyun-Suk, we have a few questions. So maybe the first 5 minutes you can take to comment and give your inputs. And then we will take up the questions. And then in about a total of 20 minutes, 25 minutes, we should close this session. We are running late. So this is where we are. And I don't see Alfredo yet, but maybe Hyun-Suk, you can start quickly.
I can hear again.
Okay, thank you. Alfredo, welcome. Wonderful. And we are at the final session, Alfredo, with Hyun-Suk and yourself and myself. So we have a couple of questions I have written down, and there are not too many long discussions we can have, probably, as you know, Alfredo. And perhaps we give the first chance to Hyun-Suk to give her comments in about 5 minutes. Will that be all right? Yeah. Thank you.
Thank you very much. In addition to the comment from Hyun-Suk Kim, which are much appreciated, thank you very much for our panelist discussion. I would like also to give some time to Dr. Islas and Dr. Harding, because as you remember, they have some problems with the presentation. Therefore,
right. So what I will do is maybe first Hyun-Suk, and then we'll take up the 2 or 3 questions that are pending, and then we will, in the end, give it to Inglas and also Harding. Yeah. Okay. Wonderful. Thank you, Hyun. Anyahasmika, Gamsamida, please come in. Thank you.
All right. Hi, everybody. Yeah, I appreciate all the the chairs and speakers, and because it's almost time's up, so I'm just briefly. And I think today we are all here together under the session theme, which is the power of food science and nutrition for sustainable planet health. And personally, to me, it was a really nice chance to hear about the health issues related with food and nutrition, and especially the latest, the state-of-art food technology, the engineering, which is quite new to me, and was a really great chance. And talking about the health issues, it was also a nice chance to hear about all over the world, kind of common health problems, like the Anna, the former president, gave us a nice summary about the sub-Saharan African, which is double burden of malnutrition, etc. And Dr. Ngozi Nnam also gives us a very interesting comparison of 6, the African, the countries, especially about the children issues. And I think Wilma's, the point was also very interesting about the Latin America, and she talked about the aging population. And aging issue is also a very serious problem in Korea too. And for example, very recent data told us that every year, like 270,000 the babies are born, but at the same time, the 600,000 the adult became the old people. more than 65 years old. So that kind of, the statistic, it gives us the reciprocal population pyramid, which arise a lot of social problems, etc. And I think the Susana's, the presentation about the processed foods is kind of very interesting. And, I have many things, but very briefly, to me, I feel that the food and nutrition, so far we worked hard, but we developed independently somewhat. But now this is a time to merge together, collaborate together to solve the problem, such as the healthy, nutritious processed foods. Is it possible? I think that many problems can be solved. So I like to, close my, the comments like this. And once again, I appreciate many things about all the presenters. Thank you very much.
Thank you, Hyun Suk. It's really wonderful to hear the summary. And I'm sure you meant a lot of these collaborations that has to take place. And I think I would first raise Alfredo. You might have also seen the questions already. The first question is for perhaps I would raise it to Sam Sagwe. You did mention about the huge impact that is going to happen in the digital world, both in the face of nutrition and both in the face of food science and technology. What will be the focus that you think, Sam, that IUFoST and IUNS has to do with that kind of a leap of exponential growth is fathomless. So what's your one-line message to us on this system? Sam Sagwe.
Okay, thank you, Prakash. This is a wonderful question, and obviously, if I knew the answer, then it would be easy. I really believe that the answer is that we are facing major changes, opportunity and threats, and we have to sit together and discuss that and find a way how to integrate all the professions, all the aspects. And I don't agree at all with having nutrition on one side and the processing on the other side. You cannot have nutrition without processing, and you cannot have processing without nutrition. This is a combined synergistic effect, and we have to realize that we are in a wonderful situation that we are providing food to the world. We are collaborating with medicine, with any field you mentioned, we are collaborating. So it's up to us to show and to lead this direction. And once we sit together, we'll find not one solution, but we have several solutions. It could be different to developed countries, to countries that are developing and so on. But the future calls for integration, partnership, and really leadership. And I think the answer to your question is IUFoST needs to lead this direction, this operation, this change. Where are we going? We should sit together and discuss.
Thanks, Sam. That's a great position that both Alfredo and me would leave the heritage back into IUFoST and IUNS. But it's a long drawn agenda. Thank you. A next question I see is from Anna Larty. Perhaps I would take the liberty to request Anna Larty. She has raised this question, number one, is how is the IUNS and IUFoST will get itself up, at least IUNS, in the future of nutrition. Perhaps it's a only an experienced person can answer that, Anna. Perhaps I like to request you to suggest, what do you think is the way forward? Even though it's a question from you, we would like to kind of invoke your brain into your experience and tell us, what do you think that we need to go together tomorrow? Anna, please.
Gosh, yeah, very Okay, thank you very much. I asked the question, you throw it back to me. Well, basically, I think that's one of the things that have been mentioned. I think going forward, we cannot really move alone, as has been said. Collaboration is critical. Collaboration, and not collaboration with the usual suspects. I mean, we should go beyond our usual suspects, collaborating with other professionals. You know, we cannot, because the issue right now, food is at the center. The moment you mention food, you are talking about agriculturalists, you are talking about microbiologists, you are talking about food scientists, you are talking about so many professions, economists and all. So that is where we should be going. So certainly I agree with that yes, collaboration should be at the center, partnerships. The second is that the future for our young scientists is now. We should not think that, you know, they will take up later. No, we should involve them right now. And hopefully, I'm hoping that in future IUNS, IUFoST will have representation of young scientists on our councils. It shouldn't just be the, you know, senior people. We should have the young ones right now on our council and not just create, you know, awards and whatnot for them. We should be making the decisions with them, because if the future belongs to them, they should right now be part of the decisions that we make about the future. That's where I'll start with. Thank you very much.
That's wonderful experience, distilled wisdom of Anna for all these years. So we take it with a great amount of respect, Anna. Thank you very much. The third question that is emerging is a common confluence of many people, including Francis, Fungo, and also Charles Savara. The total pattern is traditional food is going to really make a big difference, both in the nutrition angle, from the immunity angle, from the health claims angle. And for that, you also know that IUNS has a task force, am I right, Alfredo, on traditional and indigenous food task force we have. And in IUFoST, we had a round table on traditional food and indigenous food, which was very, very big hit. So here we are in the traditional food area. One of these suggestions that has come is how do we really go forward in this direction to capitalize on the welfare of and also health aspect of traditional foods and merge it with the technological impact of scale down and make it more available at an affordable price at the local level so that the local solutions can solve global problems. So perhaps I would request at this point of time to request Hardincia, because he happens to be a kind of a bridge between the two, and he also didn't have enough time to tell that. So Hardincia, what do you think? Where does this merging takes place, and how do you find that from the point of coming from a country with thousands of years of experience of traditional foods? Hardincia. And Alfredo has already mentioned that you missed some of the point. So maybe you can complement that also. Thank you, Hardincia.
Yes, thank you very much, Prof. Prakash and Prof. Alfredo and all the participants. At the end of my slide, I was mentioned that the application of sustainable diet or healthy diet should be in the local context. What does it mean for Asia? Also, the Asian context, for Indonesia also to the Indonesian context, because we have different problem. There is similar problem, but there is also a different problem. And we have also indigenous or local food uniquely. And even we have similar food, but there is also unique local food. Who is that?
Yeah, you go ahead. Go ahead,
yeah.
No problem.
So we be as presented by Anna from FAO that the FAO and WHO will have initiation on the revising dietary guideline for each of the countries. So revising the dietary guideline is one of the strategy to accommodate the local food, local culture, local context, local institution that will merge together in the term of the local healthy diet, not the global healthy diet. Thank you very much.
Thank you very much.
Thank you.
This is nice. Also, I would like to appreciate the comments from Anna Larte and also from the summary made by Hyun-Suk Kim. In this context, I would like also to mention that this is a very nice collaboration, IUFoST and IUNS, but also I would like that ISC take it into consideration in the next year to have other unions with roles in health, like pharmacology or even toxicology, in order to have a more global impact of life and relationship with nutrition, food science, etc. In relation with the question made by Anna Larte, which is much appreciated, I can say that IUNS not only is concerned with advancement of nutritional science, but also to encourage communication and collaboration with different bodies around the world. Of course, we have two pillars. One is the task forces implementation, and the second is the capacity building committee that is prepared to give inscription fees and cover some grants, including re-entry grants. Therefore, I appreciate that this is a real world where nutrition and well-being should be faced in personalized population and planetary issues. Thank you.
Thank you, Alfredo. And continuing on that, it's also important that we should not forget the fundamental areas of work. Even before chemistry was opening up, the structure of vitamin B12 was already deciphered. And therefore, fundamental work of food science, food technology, food engineering, and nutritional sciences has to be really encouraged at the basic level so that we know the equations at the lowest level so that we can extrapolate it and scale up it into certain systems. And it wouldn't have been possible for the vaccine to come in less than 1 year, if not for all the basic work that was done all these years. So I think we need to focus on food science, food technology, and food engineering, along with nutritional sciences, the basic work. And I hate to differentiate between basic and technology, but what I mean is the chemistry, the understanding, and the molecular level, the molecular genetics, and the entire system of epigenetics to be understood very clearly so that we have some of the future issues when we will not be able to otherwise solve it overnight with an empirical knowledge. So I think the role of science and technology and the modern tools is very important. In saying so, I think I would like to compliment Boeing for his presentation, but I would like to say, Boeing, you also said that the current generation is going through very difficult time of stress compared to their seniors. But I would also like to say at this point, you have so many facilities which was missing when some of the senior people did their PhDs, for example, with only a pH meter, nothing else. So I think we need to really capitalize on the modern tools and generate data that may be not relevant today. But as Sam Sagwe and Ferud said, and also Anna Larte said, along with Susana, it is very important that we need to look at future and generate data. Some of them may be too early for today, maybe not too late for tomorrow. So I think it's very important to focus on science, technology, and basic work, especially with a chemistry background, because that is going to solve many problems in future. We can't predict future, but we can do the basic work. Thank you. And with that, we have one more question that I would like to as a general point that has been raised, which is educate the common man or the common person, but I would say educate the women in the rural areas, especially in the low-income countries, middle-income countries, as well even in the high-income countries, to make sure that you have the right combination, as Anna rightly said, about leafy vegetables. And what is the advantage of having it twice or thrice a week, but not too much because of phytic acid. So I think it's important to educate the common person who spends a lot of time. And in the traditional foods, one sees not only the drudgery to be removed, otherwise the vanishing act of traditional food would come. So we need to make a prepared food, which is ready for about 10-15 minutes in a normal kitchen, which then will be reinventing that wheels into a greater nutrition impact, as well as an affordable food science and technology. And lastly, there's one point that Amarachi Peace has said, that nutrition education is vital, especially for mothers. I like it because once you educate a 12-year-old girl, she will take care of herself. When she will be a mother, and when she takes care of both her child and herself, and then when she's a grandmother, she will take care of her grandchildren, her children, and herself. So there's a 90 to 100-year insurance in educating a 12-year-old girl who, according to me, not only a girl, but also a boy, but I think it's very important to educate at the lowest level of school and not wait till they become a graduate student and to learn nutrition and food science. I think it's very important that should be one of the goals of ISC in building up a healthy society over a period of time, in which it is not just to be a marketed product that you can buy. It will go from generation to generation. And therefore, it is important that if we want our future generation in 2060 to be a little bit more comfortable and happy, we need to train them today, however young they are, and inculcate the habit of good food habits, and at the same time, make sure that we have our knowledge transferred to them in a most adaptable way, not to scare them with a structure, and they will run away. So I think these were the comments that came in as I looked through the chat box. And if there are any other things that we need to take up, Alfredo, you said Inglas has to also speak, right? Please invite. Yeah.
I think the time is running up. Today we have here about food quality, about healthy diet, about malnutrition, about children sustainability, about food printing, about processed food. We have here about indigenous food, about sustainable diet, and of course we have here about innovation. Tomorrow we plan to continue with another challenging task in both areas, IUFoST and IUNS. Therefore, we would like just to finish thanking all of you for attendance, and also just to give support to ISC for this excellent endeavor and this possibility to share our thoughts and also to share our initiative. Thank you very much.
Thank you, Alfredo. And before I hand over the mic to Annie, it's my great pleasure to thank Tracy from IUNS and Judith from IUFoST for having put all the things together for today. They're also going to do for tomorrow, I am sure, and it's already in play. And it's also important that this is the first kind of knowledge meeting that has happened. And I think there is no boundary. There's a borderless science has opened up now. And I thank both Alison and Annie from ISC for making this happen. Even though it was a request almost near the World Food Day, they thought about having this separately, a two-day affair. Thank you very much, but that doesn't mean it ends today. Tomorrow is more interesting, much more better than today. And I can promise you there are much more leading speakers, and all of you must attend tomorrow also. Don't go away, even though it was a long session today. But I think at this point of time, with great pleasure, thanking Alfredo and thanking all the speakers and chairs who really managed very well.